perception. So for old India, and what I mean by old India, the sort of traditional mindset, they felt that if you wanted something from the UK, you had to have a grey-haired white man telling you this thing. Now, even though I was the corporate lawyer, the one with the technical knowledge, we had to have a white grey-haired man saying it to us. The second barrier would then be, even for new India, they needed a young charismatic man doing that chat. So then we'd have Manoj come in. The technical work and the knowledge part was all me. But it was really interesting how people would only listen if it came from certain people in certain ways. So that I thought was a real interesting perspective, which I got as I did that. Now, eventually people learn and people do see where the experience is and people do start choosing you. I wouldn't be in the 3 boards that I'm on if people weren't open, because they're fintech, they're technology, and I'm the only female, like I said. So eventually you get through those barriers. But it would be great, for me, the biggest challenge for all of us women, and that's not just for Indian women, that's true across all borders, because I work across the LATAM region and Africa as well, and I do a lot of work in those countries too, with the governments. And the biggest thing that needs to change is mindsets. Mindsets of boards, mindsets of shareholders, and mindsets of stakeholders. So in the corporate world where I'm working with shareholders, we're doing a lot more to actually, we vote against boards where they don't have diversity on the board in the right sense of the word diversity. So mindset change, I think, is the biggest barrier.
Thank you. So let's stay on that idea of the mindset change. I want to come to Poonam Gupta, the CEO of PG Paper, because as an entrepreneur, I've read that you have said that when you first started out, no one would hire you, despite the fact that you had an MBA. Do you think that things have changed, and are they continuing to change as rapidly as they need to in 2020?
Well, I'd like to mention here that I'm born and brought up in India, and I moved to the UK in 2002. So when I came over here, I heard that everybody works here. The UK figures, according to World Economic Forum, is still like 40% women are employed in the UK as opposed to 23%. Well, when I came over, I was so excited. I was like, okay, I'm going to get myself a job. And I couldn't get one because I was told that I was either overqualified for the job I was looking for, or I had no experience in the UK. And after waiting for a while, I started on my own entrepreneurial journey, where I started looking into the recycling industry, which was the buzzword at the time. And I'm the founder and CEO of PG Paper Company, an industry which is still very much male dominated. And I'd say when I entered the industry, I think possibly I was the first woman-led business. So people were curious, and that's where Janvi's comments were very interesting and kind of resonate with me, where she went into the meeting and she needed a white hair, a gray hair white man, or, somebody who's a man basically representing, even though you held all the technical knowledge. I was exactly the same. People wanted to talk to my father, who wanted to do business with me, or they wanted to talk to Mr. Poonam Gupta, or, when I'd go in for meetings, people would completely ignore me and, continue to look in some other direction. Maybe one of the males who were in the meeting more often than not, it used to be my husband. And it was more because, I just used to sit him down, or he would just sit down out of curiosity. He wasn't even part of the business at the time. And I've kind of gone through that journey, and obviously 17 years in trade now, I do not have to fight those battles anymore, because the company has managed to create, I would say, quite a name for itself in the paper industry. We get recognized in the industry as either troublemakers or, innovators who lead in the industry quite from the front. Have the things been changing, in 2020? Well, things have been changing rapidly. But, when you look back at my experience, I was an immigrant in Scotland, new immigrant. Even though I was qualified, it was cited I had no experience in the UK. Things are changing, but whether things are changing for people who are still coming under my circumstances, well, I don't think so, because there are a lot of women I'm mentoring. That change is coming, but that change is slow. I mentor a lot of women, who are in business or professionals from ethnic minorities, Scottish women. And I find, some of us, kind of, we have our own struggles because we take a break because of our children. That kind of pushes us back a little bit in our career, where we then come back into the industry and we try to, get back on that career ladder. And, a lot of corporates are then cynical, wanting to take you on. Well, you've not been in industry for 3 years. I think that's where the industry needs to think differently. Perhaps create roles which are more work flexible. I mean, COVID's done a lot of it now. With COVID, people working from from their whole home, the flexibility is coming into workplace. I think the industry kind of needs to does need to change their view. I had last year meeting with head of BT, and they were asking me how I do things differently in my company because they thought there was much more inclusivity in my company, whether it was, in terms of diversity, whether, the fact is my company is 69% female, still, which I feel really proud of. And there is no gender pay gap at all. I mean, I don't even understand in my own organization why would a manager, same manager who's a male or a female would get paid differently. And I guess that's where, more of us need to speak up and be those role models of tomorrow who are willing to talk about what happened and how it happened to us and how is it changing and how are we going to be the change makers, bringing the future on for our children. For example, I've got 2 daughters. How do I want to see that change coming? Thank you.
Thank you. I got used to being called Eddie, in fact, when I moved here 22 years ago to the United Kingdom from the United States. So I'm right there with you. Dr. Suri, let's come to you now. You're the past president and the chair of the Federation of Indian Chambers of Commerce and Industry in the UK. And you're also the chair and managing director of Bharat Hotels that runs the luxury hotel chain Lalit under the Lalit Suri Hospitality Group. So I wonder if you could talk a little more about the opportunities for women within the tourism sector. Specifically, I'm worried in a post-COVID world about the impact of tourism and how this might impact women in this sector.
Well, namaskar to all of you. I'm sitting in Delhi, lovely warm day here, something that all of you are looking forward to always. The tourism industry, we're actually completely mangled, if I can use that word. We got impacted way before the COVID pandemic actually hit out. And we will probably be the last ones to actually recover from this. For us, it's been this entire experience unprecedented completely. But for this industry, it's really, really been a turning point. We're all introspecting to try and figure out what is the future of our industry. This is an industry where people serve people. And if we are going to have social distancing or physical distancing, how are we going to ever get back to a restaurant which is buzzing with people, a nightclub which is shoulder to shoulder, a large Indian wedding, big fat Indian wedding, meetings, and even just luxury and spa. I mean, if you are in a spa, and India is very well known for the Ayurvedic spas, how do you cope up with the masseur or the masseurs with you, and where is the distancing that comes in? So as an industry, we are really distraught. But if I were to put that aside for the moment and talk to you about what are the opportunities for women in this industry. So let me just tell you that, and I'll talk specifically about India. Most of the Indian employed women are actually are employed in the unorganized sector. They don't have paid jobs. So let me put it like that. And they are contributing immensely to this industry. Now, if you talk about a small roadside dhaba, as we call it in India, you will find that of the 4 people working there, at least 3 will be women, but it's unorganized. When it comes to the organized sector, which I'm a part of, we do have a fair representation of women, but very few women in the leadership roles. So while there's housekeeping, there's front office, there's sales, and there's a lot of women representation. Uh, if I put a ratio, India, it's about 12% only ratio of women working in the organized sector. But what have I done in my own company is that I've actually took it upon myself to bring in that ratio, and we're currently sitting at 18%, which is a lot better than what the ratio of India is. However, when it comes to the leadership roles, that's where it begins to fall back. As was mentioned earlier, the women or the girls, young girls, they get married and they take a sabbatical for 3 years. But in those 3 years, the men have actually climbed up that ladder. So when they come back, there is that setback that they get. I mean, they may be probably better, more devoted to their job, perhaps even more knowledgeable, but they've lost that time, and therefore the struggle comes up for them to catch up with the men, and that's the main reason why in our industry I find that the women begin to miss the leadership roles. But I have to say very proudly that I have 3 women executive chefs in our hotel, which is literally a record, and a fairly large number of women in leadership roles. The barriers, as was mentioned earlier, it's the mindset. It's really the mindset, and it's the mindset of everyone, of parents, of siblings, of the male members of your family. There's a mindset change that is required, and it's the same everywhere. I mean, there's no difference. Let me tell you, whether it's in India or whether it's in America or it's in the UK, I think the mindset is what really needs to change. And if we, all of us here, can be in any way a catalyst to that mindset, I think we'll have achieved something. So thank you for that.
Thank you. So Shalini Arora, let's come to you now, the CEO of Savannah Wisdom, which is a foundation committed to social change for a better world, which is what we need right now. And so I wonder if you can tell me a little bit about your thoughts on that changing mindset and what Savannah Wisdom and you do through that and the B&M Community Fund in order to change.
Thank you for the opportunity to speak today. I think that's a really interesting comment there about a change in mindset. And a lot of the other panelists have talked about the pull factors in terms of getting women into the workplace. But I think, and our research has demonstrated, that we do also need to look at the push factors. And that comes from parents, from communities, and from perception. Evidence shows that women from the BAME community are 20% less likely to be employed than their counterparts in the UK. And we know that girls consistently outperform boys in compulsory education and are more likely to go to university. So why this disparity in the labour market? As a foundation, we conducted some research here in Manchester with young women aged 16 to 24 to try and work out what those factors are. And there are cultural factors still, and that's the mindset, amongst other things, that needs to change to tackle those barriers. Some of those cultural factors were parents not being aware about different career opportunities, or still believing that the medical profession is the only worthwhile career for their daughters. And we've not really made progress in that mindset between the generations. Girls themselves do also lack the confidence and the self-belief to think that they can achieve something different and step outside the box and have an alternative career to the ones that they see within their communities, whether it's a teacher or a doctor or a police officer, because they lack meaningful role models, realistic role models, where they think, well, if that person can do it, then I can as well. So there are lots of different things that we have discovered through our research which are happening within the community still, and those are the mindsets that we believe we need to change as well. Building skills, increasing confidence, and really speaking to parents and to people within the communities about the opportunities for young women in this country.
Thank you. Baroness, I wonder if you could build on that, what you've just heard there in terms of the concerns about the push factors. And I wonder if you could also touch on the issue around whether remote working and digitization creates new opportunities that we may not have seen before.
Indeed, I think we've had a really good contributions, and I think all the issues that have been raised, both in terms of mindset, pull and push factors, are very critical. But it's also encouraging that the steps are being taken, particularly by women themselves, to actually, promote other women. But I think, having said that, the progress, in my view, has been slow. It's been slow because I think we've not seen a change, a paradigm shift, and a change in the mindset. And some of the cultural factors actually remain very much in play. The cultural factors are there, but I do think that one of the things I want to highlight is the domestic responsibilities of women, and particularly when it comes to taking time off to have children, they begin to lag behind, not just the tourism industry. I saw that in the legal profession, I've seen that in the civil service. So I think there's a whole range of issues which actually impact on the progress of women. When you're looking at, in terms of, are there opportunities on the digital platform? Of course there are. I think what the pandemic has done has actually amplified where the real issues are. And I think that highlights where we need to focus. Because the title of this conference is, be the revival. If we want to be the revival, we've got to make sure that women are an integral part of this. While I think digital working and working from home will provide flexibility in terms of work, but I think we cannot take that for granted. We will have to ensure that people are given the necessary skills. There's a real change, a mindset and a shift in the way we work. Because I think the working patterns are such, they're designed the way men work. They do not really take into account the conflict that there is between internal and external responsibilities of women. So while there are opportunities, and I think these have been highlighted in the pandemic, but I don't think that we can sit back and say that will automatically happen. I think this will mean that we need to think of strategies. And what has frustrated me is that we've had this conversation and dialogue for a very, very long time. We've had report after report which tells you there's dismal progress. But what we really need to do now is make that step change where we begin to impact on policy and thinking, because there's a whole range of initiatives, there are a whole range of projects, which are really significant and are making some difference. We need to scale this up and make sure these actually impact on the way policies work. So I would emphasize that even on the digital and the technological impact, of course, the potential is enormous. But it's a huge potential, especially here and here in the UK. But it needs to be exploited. To do that, you've got to make that a very conscious effort of every action you take in education, in policy, in any initiative that you take forward.
Poonan, I wonder if you could build there on what we heard from Baroness, because as an employer of a lot of women, you must have seen some of the frustrations that they faced over the last 100 days and more of educating their kids at home, continuing to have to look after the family while working over a digital platform. Anything to add and any bright highlights that you can tell us?
Well, some of the points that the Baroness has said, they're actually really, really relevant. Now, going back to these 100 days, let me tell you a little bit that actually for the first 12 years of starting my own business, I worked from home. And my pull to work from home was the fact that I have two daughters, who came along very soon after I started my business. And motherhood in itself is a full-time job. So being a CEO and a founder of a company, as if that's not a full-time job, then being a mother of two children, and actually during that period of time when my older one was just 1 year old, I was also wheelchair bound for a year and a half with a misdiagnosed disease. So I've kind of been in the thick of all of that, working from home, juggling my work life, my children, my family responsibility, coming from, I'm part of an Indian family, Indian joint family actually in Scotland, where there are a lot of pressures also as a daughter-in-law on, the responsibilities that I have for the household. So I think I've kind of seen it all. And and have gone through it all. And when I've done all of that, I guess it, as a CEO of my company, I have a natural understanding of what women in my business or my friends, who are looking to get into a profession, or people who ask me for help in terms of mentorship, I kind of understand their struggles, because their struggles have been my struggles. And that makes me a little bit more, so during, like, let's talk about, so that kind of allows me and to understand their requirement, which I understand are different from the male employees or even, management that I have. And one thing my company's always done, pre-COVID as well, for last with the 17 years we've been in existence, is allowing for that flexibility. Initially, it was meant to be for women, mothers who are trying to come back into job. Again, Baroness Parashar and both Dr. Suri mentioned it, how women, yes, basically get kind of left behind when they take this time off, trying to bring up their young family. And I recognize that, because although I worked with my children, I had that, you can say, opportunity to work from home, being the owner of my business. Now, that's not something that an employee can say that they can have. So I kind, and then, so I basically started trialing with, having a finance director who had children who were under 4 years of age, and see if I could provide her that flexibility to work from home, and eventually kind of shifted to the men in my company as well, because actually, as a young father, they are now expected to share responsibilities, and they should. And they can do that when we also understand their requirements in that area. So actually, if you think about my company, which has already been geared for last 17 years, with giving people flexibility, people already working from home, offices in different countries where people, are set up to work from home. We were kind of, you can say, a little bit, we didn't take the full blow of COVID, as such, and this sudden think about working from home. Our systems were already set up. The support system was already in place. Where we struggled a little bit with our employees, I would say it was mainly the men in the company, because they were suddenly home, and they had the children running around, and they couldn't cope with it, and they couldn't be productive, as they would say, because too much happening in the household. And we just try to provide them support through their managers, Zoom calls, telling them how they can try and find that work life balance. Most of the women in my company, actually a lot of them are young mothers, but they've already have had that support. So it's kind of, and they're used to working with our work culture that we have during, so that kind of actually helped them in a positive way. I would say during COVID they were able to kind of juggle their responsibilities like they did. So I mean, I don't have any exciting stories to tell you, but I'm proud to say that my females in my team remained highly productive even in these most difficult last 100 days.
Interesting. So, John Javi, can you build on that a little bit? Because I know that you're an independent chair on the board of a fintech. Do you think we see enough women in senior positions? And is it representative of the talent that's out there?
Well, definitely not representative of the talent. I can give that answer very quickly. But I do want to take a slightly contrary view to something that Shalini said about cultural, and indeed maybe we've all said it slightly. I think when we look at Indian cultural factors, even within India, that is a continent within itself. So in a way, sticking BAME together, I think, actually skews the statistics completely wrongly. I mean, Priti Patel, who just preceded us, is a great example of somebody that has got to places, I think, partly because of her Indianness personally. And personally, if I had to speak for myself, this idea that one of the barriers is having kids and all of this, actually, for me, Indian culture helped me. The family helped me. I didn't take any time off. I mean, for anybody that's had to work in the corporate world and in the technology world, that Malcolm Gladwell 10,000 hours is critical. To do that 10,000 hours before a certain age is so critical. And that's true for all of us. But for women, you're quite right. If you take that gap, you don't get those 10,000 hours. So for me, actually being Indian helped. Both my parents were doctors. And it was fantastic to watch them because they jointly looked after my kids for me. even though they worked. And I actually, a lot of my female friends that come from non-Indian cultures say to me, I wish my parents had done that for me. And it's just not inherent in that. So I actually think sometimes moving away from our own inherent culture, so that this idea of be the revival, I actually think rather than technology, I think what COVID has given us the opportunity to do is reevaluate societal values on so many levels. And I hope that's what we really get. Certainly, again, in the corporate world and in the technology world, where we're talking to shareholders, where we're talking to stakeholders, for me, building sustainable and resilient narratives are so important. And if you want to build sustainable narratives, you need women in leadership, because it is so inherent to the way we think. We don't, for me, when I look at my businesses that I'm in or any of the companies, I'm not just thinking about the next quarter and the dividends at the end of the next year. I'm thinking about what happens for my kids, what happens for my grandkids when I'm doing this. And that ability to think long term, I think, needs to be embedded in organizations. And if you get more women doing that, I think that helps. Technology has been both, for me, it's been both a positive but also a negative, because in this lockdown what I'm seeing is that what you're getting is social bubbles and an increased amount of echo chambers that are happening. And actually I do a lot of board evaluations, and one of the things I've realized when I've listened to decision making in boards, at the moment what's happening is you have at least 20% less time. You're doing it virtually. And what you're doing is you're reacting to a lot that is being said on chatter. There's so much noise out there. And I think people are not really looking at this from the perspective. I hope what we do is really reevaluate where society sits on all of this. And what we need is men. I mean, some of the things that we've instigated in our organisation is forced paternity leave and sharing of time off once kids have happened. So both the parents, and once you get men taking time off, once you get men coming back part-time, it's amazing how they suddenly realise what the difficulties were. And the other thing I'd really want to stress in this is, unfortunately, certainly in the Indian culture, a lot of what has happened is exactly Poonam's experience, where because they couldn't do it as an employee, they end up setting their own business up. And so we've had we have a lot of entrepreneurs that are women, and they've set up their own business. But actually what I do want to see is if we can reevaluate actually how we do our practices in organisations, what we will get is women rising to leadership, because it's the right thing to do. It is absolutely, for organisations and for societies, the correct thing to do. This is not just about pushing people into a field that they don't necessarily want to go to. And the final point I wanted to make about that is actually women at home are of huge value to society as well, and we shouldn't devalue that either. And I think almost part of the problem with this is that we don't put a value on that. And it's interesting, once men have started working from home, we've suddenly started putting a value on it. So I think that's one of the things we really need to change.
Time, and I do want to get our final two panelists another chance to come back in. Thank you for those comments. Dr. Suri, can you comment on whether you think that an Indian family can actually be of more help to women? And I wonder if you can comment on the digital aspect. How does that work within a tourism sector?
So I definitely think that the Indian family values are extremely helpful. Because if you are living in a joint family and you have supportive, I mean, of course they have to be supportive, then you do not necessarily have to take a very long sabbatical. But if you are a nuclear family and you are just, yourselves and your husband, then it becomes a natural choice for the woman to take the sabbatical. Coming back to the digital platform, so, in our industry, we really can't work from home because we have to be out there in the field. A certain amount, for example, sales or some element of marketing can be done, but the chef has to be on board. The service boy and girl have to be there. The housekeeping has to do the rooms, and all of that. So for us, it's really been extremely difficult for us to even hold on to people, because making them sit at home, they're not really that productive. But they are, like I said, some segments are, but the bulk of the segment are really not being able to be productive. So it's different. However, I do feel that the opportunity of being able to work from home has clearly benefited the women across the world. It really has, without any pressure on them, of the children, of home, and the duties that they need to perform at home. They've actually become doubly productive. As was mentioned, that women, what they have been able to contribute to this pandemic is not being measured properly, because not only have they contributed to their homes, but they've also contributed to their work. So I think that from that point of view, yes, the pandemic has helped. But in our industry, no. Working from home.
Not possible. Look, I'm just going to give Shalini the final word. Can you just reflect on what you've heard from the panel? And perhaps one final question to you would be even better if. So how could you see things in 5 years better than they are now?
Okay, just to reflect on what the panel have said. Janavi, I take your point about using statistics from the BAME community to make my points, and I'm going to use another one, that on average, women from the BAME community take home £90 less per week than their white counterparts, and we don't have that data split out between the different communities. And that would be my worry about the increased flexibility in working from home and the digitization that goes with that, because I worry that without addressing some of the first points that were made about unconscious bias and some of these cultural inequalities that we see, that there is a risk of that divide and that gap actually increasing as women take up some of those lower paid jobs within the gig economy and also try and still do it all and have their families and then work all hours. And that is going to have an impact on their mental health and their stress levels. So I do think there is a risk as we come out of this and we think about what a fabulous opportunity and there is to be more flexible with our working hours and how digitization has helped that. There are some serious considerations that also need to be made. Sorry, Edie, what was your final question?
Well, we've run out of time, so I think we'll just leave it there. But it is my great thanks to all of you for being such an empathetic and listening panel. You've all really responded to what I've heard, which is sometimes quite different than what we hear on a manel, as we all know. By the way, during this panel, my Ocado order has arrived, and my family has done the job of taking all that food in. So, you know, there is hope for us all. So enormous thanks to all of you for being with us here today, and do continue to stay in touch.
Thank you, Eddie.
Thank you very much indeed.
Thank you very much.
Thanks, ladies.
Thank you.
Thank you. Nice to see you all.
Thank
Bye-bye.
you.
Manoj Ladwa, and I have the privilege of being the founder and CEO of India Inc. At India Inc., we pride ourselves in producing incisive content, engaging global leaders, and hosting impactful conversations. At India Inc., we believe in winning partnerships by sharing amazing ideas and exploring great opportunities. We believe in the power of shared values and shared ambitions for a better tomorrow. So welcome to India Global Week, where India meets the world and the world meets India. Enjoy the discussions and let's all be the revival.
And a very warm welcome from me as well. My name is Edie Lush, and I'm the host of this particular digital stage within India Global Week. This session is all about healthcare collaboration, building a new healthcare paradigm. And as we've seen noted by many of the speakers today, including just a few moments ago, Priti Patel, the UK Home Secretary, healthcare is absolutely one of the strongest pillars within the UK-India partnership. Partnership was one of the things that we heard Prime Minister Modi talk about as well when he opened the UK-India Week conference yesterday. So to build a little on what we'll talk about today, coming out of the most challenging health crisis in a century, the opportunities of an importance of collaboration is critical. COVID-19 has highlighted how much we rely on healthcare workers, our creaking, overburdened systems, the importance of digital solutions, and the collaboration on vaccine solutions and production. What this session will be about, first we'll go to a conversation that I had earlier with Matt Hancock, and then I will hand over to our panel, and our panel will be very expertly chaired by Dr. Aman Puri, the Consul General of India. So I will now toss to a conversation that I had earlier with the Secretary of State for Health and Social Care in the United Kingdom, Matt Hancock. Welcome to this India Global Week session on healthcare collaboration, building a new healthcare paradigm. I'm Edie Lush. I am delighted to welcome to the stage Secretary of State for Health and Social Care, Matt Hancock. Before his current role, he served as Secretary of State for Digital, Culture, Media, and Sport. And that digital aspect has been vitally important during the pandemic. Speaking of COVID-19, for those of us in the UK, there were days during the pandemic when my family and I huddled around our televisions, waiting for the Secretary to appear. There were some very dark days when the Prime Minister was in hospital, and I will never forget the moment when the Health Secretary said, COVID-19 is in retreat in the UK, and that was exactly a month ago, 9th of June. Today, we're going to focus on the importance of the relationship between the UK and India. That's a good place to start, COVID-19. So first of all, Secretary, tell me about the collaboration between the two countries in healthcare. Let's start with most recently during the crisis.
Well, yes, during the crisis, there's been incredible collaboration between the UK and India, especially in two areas. The first is health tech, and India, of course, is a tech powerhouse. And across the world, where people have access to technology, that technology has been used not just for the human social contact that people have yearned for and has been made so difficult, but especially for access to healthcare. We've seen in the UK a radical increase in the amount of telemedicine. The proportion of our primary care GP surgeries offering video conferencing has gone from 3% to 99% during this crisis, and we work with a whole number of Indian companies to help make that happen. The second area is the supply of medicines. Prime Minister Modi has called India the pharmacy of the world, and it's true. And I've worked with with my opposite number in the Indian government to ensure the safe and continued flow of medicines during the really difficult days of the crisis, and that has been achieved all the way through, and I'm very grateful to the work of the Indian government in helping to make sure that that could happen. So, we're both countries that have faced this and are continuing to face the challenge of COVID, and we've got a lot to learn from each other.
So I wonder if you could say more about the contribution of Indian healthcare professionals in the NHS, and perhaps what this new visa regime means to those professionals.
Well, this is incredibly important. There's an increased number of people from India who are working in the NHS. Of course, the NHS is one of the most international organizations in the world. And through its history, it's drawn people from around the world in service. And we have not only do we have a very high number of people from India working at all levels in the National Health Service, but that has recently increased. And in the last 2 years, figures published this morning show that India is the second highest in terms of countries from around the world from which people have come to the NHS. So it's an old phenomenon, it's an old partnership, but it's also very recent and very real as well, especially in terms of big increase in the number of nurses coming to the UK. We introduced an NHS visa about a year ago, and this cuts both the cost and the bureaucracy of getting a visa to come to the UK for those with health qualifications. And I'm delighted to see the numbers going up, people using the NHS visa, and there's a lot more to come.
You spoke about the pharmaceutical industry. I wonder if you could tell me a little more about the contribution of India's pharmaceutical industry to producing quality and affordable medicines for the NHS, as well as further research partners within pharma.
Well, the Indian pharmaceutical industry is one of the world's giants, especially the production of APIs, the active pharmaceutical ingredient, and also at the research end. And clearly, the UK life sciences research is amongst the strongest in the world too. We're very proud in the UK of having made the first discovery of a clinically effective drug. A really old drug that India has produced for years and years, dexamethasone, that is effective around the world. And so the combination of collaboration at the research end, and then also, frankly, we are a very big buyer of pharmaceuticals. Around 40% of our medicines have some part of their manufacturing in India. So we're a big customer, and at the same time, the levels of collaboration on research are important, and they'll be increasingly important in the future.
So I wonder if you could say a moment about supply chains. We're in this moment where some parts of the world are still grappling with COVID-19, and India is among one of those countries. On the other hand, in the UK, we're coming out of it, and I'm one of those people who was obsessed by looking at the curves. And I wonder, however, as we talk about nationalism versus this former globalization of supply chains, I wonder how the healthcare industry fits into that, because as you've mentioned, it's so intertwined, and so it's so important to have that international collaboration.
It is very important, and I think a lot of people are asking big questions following COVID. But one of the things that has stood up, despite the unbelievable strain that it was under, is the medicine supply chain. It has, even in the most difficult times when countries were under full-blown lockdown, we managed to continue with the global pharmaceutical supply chain. I think that there is work to do globally to ensure the resilience of that supply chain, especially for some of the products that are produced in very few places. That is important work for us all, because ultimately, we're all human, and so the pharmaceutical industry works for us all. So there is work to do there, and I think it's something that the UK and India can gain an awful lot out of collaborating on.
So finally, if you could gaze into the future, perhaps just a year or 2 years, where do you see, as Health Secretary, the importance of the UK-India relationship?
Well, I think there's a huge amount of opportunity. We have a bilateral work through the JETCO process to make sure that our trading links are stronger. Of course, as the UK leaves the European Union, so our relationship with India has yet more opportunities. In the area I'm responsible for, we're currently looking to build a health data and bioinformatics and genomics focused partnership with Indian counterparts. And we've just concluded an initial landscape analysis in this space, because I think that the technology, the data and the genomics, because after all, genomics is essentially the provision of another data stream. You can simplify it as much as that. This is an area where India has huge expertise, and the UK has some of the world-leading research too, and through the NHS also has access to that coherent data structure that can help with the research. So there's a India has the scale, and both India and the UK have the research capability. So I think it's an exciting time. It's a very difficult time, but there's big opportunities too, and we really need to make the most of them.
Secretary of State for Health and Social Care, Matt Hancock, thank you very much for joining us here at India Global Week.
It's great to be with you.
So now for the next part of this session, I'm going to hand over now to the very capable hands of Dr. Aman Puri. He's the Consul General of India in Birmingham. Over to you to introduce your panel.
Thank you, Edie. Namaste. Very good morning, ladies and gentlemen, and good afternoon to our panelists and viewers joining from India. I would like to thank Manoj Ladwa for bringing all of us together on this platform from different parts of the world. Very special thanks to Right Honorable Matt Hancock, Secretary of State for Health and Social Care, for sharing his valuable insights and for committing his support to UK-India Healthcare Partnership. This session, Healthcare Collaboration, Building a New Healthcare Paradigm, is very timely as the world faces an unprecedented healthcare crisis due to the pandemic, as the global economy is being held hostage to COVID-19, and the revival of the economy demands us to find effective solutions. It is therefore imperative for health systems across the globe to pool their resources, to work together to find solutions, and to strengthen health systems to emerge stronger in a post-COVID-19 world. I would now like to formally welcome and introduce the distinguished members of our panel today. Leading from the Indian side is Principal Scientific Advisor to Government of India, Professor Vijay Raghavan. We have Karamjit Singh, Chair, University Hospitals of Leicester Trust, Dr. Indu Bhushan, the CEO of National Health Authority of India, Professor Andrew Hardy, CEO, University Hospitals Coventry and Warwickshire NHS Trust, Dr. Praveen Gedam, the Additional CEO of the National Health Authority of India, joined from Mumbai, Her Majesty's Trade Commissioner from South Asia, and British Deputy High Commissioner for Western India, Alan Gemmell. We are pleased to have Dr. Sangeeta Reddy, the Joint Managing Director of Apollo Hospitals. We have Roshan Shetty, representing one of India's most admired IT giants, Infosys, who leads the life sciences and healthcare for Europe, Africa, and Middle East. We have David Hyton, the chair for Maidstone and Tunbridge Wells NHS Trust. And finally, Madhukar Bose, who is leading on digital health and South Asia from the Department for International Trade, the British government. Now I would like to bring in Professor Vijay Raghavan to speak about his experience of combating the COVID-19 pandemic crisis in India and what the opportunities and possibilities he sees collaboration between UK and India. Professor Vijay Raghavan.
Thank you very much, Aman. It's a great pleasure and an honor to be here. And it's particularly wonderful to be here with all my fellow panelists at this very important India Global Week. Collaborations between the UK and India have a long history and a very productive one at that. And I don't have time to go into that, but it's on those foundations that we're building now. I'd like to briefly share with you India's key learnings first from this pandemic. India is unusual amongst the post-colonial countries in that it's got an extraordinary investment in high-end science and technology, as well as a set of challenging problems which beset a country which is developing of this size. But India, therefore, has an ability to not only understand our problems, but to do something about it. And we've been doing really well in many, many sectors over the years. But this pandemic has taught us how important it is and how able we are to come together and work. It's been incredible to see every aspect of our society. We used to be very critical of different layers of being isolated from each other, but this pandemic has brought people together to solve problems in a way which is absolutely impressive. Our industry, no matter what they have been making, have repurposed themselves to make all that is needed for the pandemic: personal protective equipment, ventilators, other hospital devices, and so on. Our academia, and whether they are mathematicians or astronomers, have come together with entrepreneurs to develop and take to manufacturing components which are so essential now. Our vaccine industry, which is one of the largest in the world in terms of manufacturing capacity, 2 out of 3 vaccines a kid receives anywhere in the world is made in India. They have been amazing in coming together along with entrepreneurs, academia, in being active at the discovery end. So this pandemic has brought together people from public sector, private sector to work together in a manner which is absolutely stunning. The current play of research on vaccine development is something I'll briefly attend to. And that, as we know, vaccines normally take about 10 years to make and cost a few $100 million. The world is now trying to make a vaccine in a year for $3 billion. So that's fast tracking. There are many things which you can move ahead by doing things in parallel. For example, trials and manufacturing. If you manufacture a vaccine which doesn't pass trials, you'll have to dump it, so you need risk capital. So this is something which organizations all over the world are doing. Indian companies are also manufacturing vaccines as well as partnering internationally in multiple ways. There are over 100 vaccines globally being looked at, candidates, and in India, there are attempts at over 20 credible ones of size, that is, and now 2 of them have gone into phase 1 trials, and a few more will be coming in very shortly. So these are Bharat Biotech and Zydus Cadila. And so our major vaccine players: Serum, Bharat Biotech, Cadila, Biological E, Premus, Serum Institute for another vaccine, Minvax is a startup. They're all working on vaccines in a big way. Now let me come to a very important topic, which is about how we can have better ways of collaboration between the UK and India. As I said, there have been extraordinary collaborations over decades, and these have typically had, just like I mentioned about expertise in India being distributed, but earlier not working together enough, and now working together. In a similar manner, our collaborations with UK have been with multiple different UK agencies on different topics, but not looked at the collaboration in the academic R&D area in an integrated manner. There have been previous attempts to look at industry-academia collaborations, and there too, inevitably, it moves towards slicing the pie in a manner where different components get their bit. This is now time for us to move together in major collaborations which affect positively not just the UK and India, but the whole world. What could those be? In terms of healthcare, you heard Secretary Matt Hancock pointing out the areas of collaboration, and I would like to reiterate that. India's Arogya Setu testing and tracking app now has over 110 million people. It has, in the feature phone collaboration, another close to 100 million people, and that is combined with manual testing and tracking, and that back end has been incredibly valuable in this pandemic. This has shown how, in a very short time, Indian IT industry in partnership with our health can do wonderful things. You'll hear later from Dr. Inder Bhushan about how, similarly for other areas of health delivery, whether it is getting insurance to the last mile or telemedicine, what India's capabilities are. This is an enormous area of collaboration, both for the which will be of value both to the NHS and to our health system. Our health system is much more diverse than in the UK, but that diversity brings great strengths. And Sangeeta Reddy here will tell you some of that. So I think that's an area of extraordinary collaboration, taking on ambitious programs which will benefit not only each other, but other areas of the world. So what are the areas which the government of India has to facilitate this? Now, over the last few years, there have been extraordinary measures taken to stimulate startups in India, and also new ways by which money from corporate R&D and from corporate social responsibility can come for collaborations over here. There have been also direct budgetary allocations for international collaboration, which of course must go up as these happen. Indian government agencies and Indian science agencies have taken on big missions from deep ocean, biosciences, biodiversity, and so on. So I think the biosciences mission, which will take off soon, it got delayed because of the pandemic, is an extraordinary area of collaboration. This is going to look at looking at genotype and phenotype across India and linking that to decision making, and a partnership with Genomes England, with the NHS, and with the Indian Health Services would be extraordinarily valuable. I think I'll stop here and thank you very, very much. The future for our collaborations needs to ramp up extraordinarily more than it is now, but I think we have everything in place to do that. Thank you.
Thank you, Professor Vijay Raghavan. Now that we've heard the perspective of how UK and India have a very strong foundation of healthcare collaboration, but it's probably the time to take it to the next level. I'd like to bring in Alan from Mumbai, who I believe has recently joined at a very challenging time. So Alan, from your perspective sitting in Mumbai, how do you see India's handling of the COVID-19 crisis, bringing up some lessons perhaps for health systems globally? And how do you see the possibility and your ideas to promote trade specifically in the areas of health tech and pharma between UK and India?
Well, thank you very much. Thank you very much, Aman, and thank you very much to Manoj and the organisers of India Week, which grows in scale, impact and importance every year. I'd also like to thank Aman, you for your incredible service to the UK-India relationship, and in particular the recent success of your launch of the West Midlands India Partnership. Dubai's gain certainly is our loss, but we're pleased that you'll be closer to us in Mumbai. As you say, I'm talking to you from Maharashtra, and it's very clear here that the government here and across the country has a laser-like focus on tackling the outbreak, and that is the context that we're working in. But in my first 4 weeks in the job, although we're in this challenging context, I'm incredibly optimistic and enthusiastic about the UK-India partnership, and you've heard some of the reasons for my enthusiasm and optimism over the last 2 days, from the introduction from Prime Minister Modi or the speeches from British ministers today, alongside my own introductory calls with senior business people in both countries. There's an incredible opportunity for the UK-India relationship right now to respond to, and we're seeing that response, the response to COVID and this outbreak, but also to think about the kind of ambitious partnership that we want to have in health tech, in cyber and space and green technology for the rest of this decade. And many of those early conversations I've had have also been in the pharma space. So I'll come to the points you've raised in a moment. I wanted to take a second to recognise, as the Secretary of State for Health did, the incredible partnership that Britain and India have had over the last few months. And that's a partnership that's included my boss, whom you've heard from today, the Secretary of State for International Trade, Liz Truss, worked closely with our opposite number, Sri Piyush Goyal, to have an open dialogue in commerce and industry. But that's a dialogue that led to the export of 3 million tablets of paracetamol to the UK, and also to the export of 10.95 million masks at a critical time for our country. It's also a dialogue, though, that in trade made sure that British businesses who had key workers in India who had to find a way to get to their offices were able still to do. And we're incredibly grateful to the government here in Maharashtra and the central government for the partnership that we have already had in response to COVID. And you've heard from my Secretary of State about what that partnership in trade might mean in the longer term, where in her earlier session today she talked about developing a roadmap for our relationship, and one that allows us to keep all options on the table, including even progressing to a free trade agreement. You asked some questions in my session, Aman, and those were principally what more might we do to make and manufacture together in the health space. And certainly for my team at the International Trade Department here in Mumbai, making in India is an important part of our strategy and an important part of for British companies. As you might have heard, I'm sure many did, at the Global Vaccine Summit, AstraZeneca and the Serum Institute's announcement to have 1 billion doses of the University of Oxford's COVID-19 drug and to make those available to low and middle income countries with a commitment to provide 400 million doses before the end of 2020 is absolutely in the centre of that sense of designing and making, designing in the UK and making in India. We've also seen, though, incredible opportunities and connections in the pharma sector before this outbreak. The large pharma and medtech players from the UK, like GlaxoSmithKline, AstraZeneca, Reckitt Benckiser and Smith & Nephew, all have manufacturing sites here in India and make significant investments here. You might know that with in the brilliant CII Grant Thornton tracker launched earlier this year and launched in India yesterday, 15% of Indian investment in the UK comes from companies in the pharma sector, companies like Torrent Pharma, Intas, Piramal, Biocon and Cadila. I thought I'd also just underscore, though you can pick up from these remarks, that the UK's trade effort in India is about partnership, not one-way interaction. And the International Trade Department's Healthcare Artificial Intelligence Catalyst was part of that, a project envisioned after an agreement in technology between our prime ministers, where the artificial intelligence from the UK is being used to empower ASHA workers to follow standard protocols in rural areas. We also have Noka Robotics working with IIT Kanpur and the wider industry to develop affordable and portable ventilators. And there are many other examples I could give you. You've also heard in terms of this partnership from our Secretary of State about the importance of Indian doctors and nurses to the UK's healthcare workforce. And Prime Minister Modi yesterday spoke about the importance of India's talent and India being providing talent for the world. That's been important critically important to the UK, and Health Education England are already working with a number of state governments in India who are looking to expand this into a more permanent presence in our country. That health workforce remains at the heart of our future planning with the Government of India, both through our bilateral MOU, but also in our discussions with the Indian Board of Governors. We've developed a global learners programme, an ethical UK-India government-to-government programme for nurses migrating to the UK. The programme takes the money that NHS hospitals would have previously given to recruitment agencies and focuses that on training for nurses and a package of support during their transition. It guarantees a core package of support, including free language and clinical training in India, free flights to the UK, visa, health surcharge, and 3 months accommodation in arrival in the UK. So we're very much invested in developing and supporting this health workforce. Finally, to return to my initial remarks, we have seen this laser-like focus here and across the country on the response to COVID, and it's clear that every country has taken decisions based on their own contexts. India's tailored solutions are serving its response well, and we've already heard about the incredible popularity of the Yogya Setu app. In addition, we've watched as the domestic PPE manufacturing industry has grown from a very small amount to almost 500,000, 5 lakh pieces a day, an incredible transformation in response to this outbreak. Overall, as I say, we see an opportunity for an ambitious and optimistic partnership between our countries, and we hope to continue to build that together. Thank you for involving me today.
Thank you so much, Alan. Very important to have your perspective, and I would like to come back to you during the course of our interaction once we've heard all the panelists. Now I'd like to bring in Dr. Indu Bhushan, who is running the world's largest government-funded healthcare insurance program, and NHA is uniquely placed to partner with its counterpart NHS, and it's also been playing a very critical role in handling and combating the COVID-19 crisis in India. Dr. Indu Bhushan.
Thank you very much, Aman. And I've always admired your sense of focus and the way you organized this whole forum and also in previous years. So thank you very much. And thank you very much for inviting me to this forum. The current pandemic, of course, is a great big tragedy. It has led to unmeasurable human suffering, wiped out several trillions of dollars from the face of the earth, and reversed several years of development gains in terms of poverty reduction. However, I believe, like other crises in the history, it is forcing us to evolve, reorganize, and come out stronger than before. As you may recall, that after the earthquake that hit Gujarat last decade, or Kathmandu in Nepal, or after 9/11 attack in USA, the countries came out stronger and better equipped to manage such disasters in future. Similarly, when SARS hit East Asia, all the countries in East Asia strengthened their public health infrastructure, expanded their financial protection for health, intensified their infectious disease surveillance programs and management programs, and deepened the regional cooperation for sharing of information. And that protection that they did for SARS is showing now, and their response to the current crisis, current pandemic actually has been very strong. And although this pandemic has started from South China, and countries close to South China actually have not been affected as much as other countries, precisely because they were prepared because of the SARS and they could respond to it much better than others. I also believe that the current crisis is going to be forcing all of us, and we'll be changing several things for good. And in this forum, I would like to raise 3 points which I believe will happen. One, there will be a greater focus on universal health coverage. Of course, it's a major global health goal and part of SDG 3.8, but it has become even more important and urgent than ever before. The crisis has shown that not only poor, but non-poor are also suffering on account of accessibility and affordability of healthcare services, because cost of treatment is high even for non-poor. While we all understand and widely agree that strengthening primary healthcare is important, but at the same time, we can't neglect the secondary and tertiary care. The current pandemic has revealed the importance of developing the inpatient capacity. Moreover, the management of non-communicable diseases is equally critical as people with comorbidities are suffering more than others in the current crisis. Thus, expanding financial protection for health for all with strong focus on non-communicable diseases and strong focus on inpatient care is important. And I believe that this crisis will lead to expanding the coverage, both in terms of number of people covered, but also the number of health conditions covered. Second thing that is likely to happen and should happen because of the crisis is there should be greater emphasis on digitizing healthcare. This has emerged as a centerpiece for stronger surveillance, as Professor Raghavan mentioned about Arogya Setu and other efforts, but also for continuing the delivery of healthcare in such times. Telemedicine, as was mentioned earlier, is helping the sick to stay connected to the healthcare services in these times when the physical connection with doctors is not feasible. At the same time, critical data is being collated and analyzed in helping and sharpening the focus and the focus response to the pandemic. We in India have accelerated our efforts in this direction, and we have just launched a national digital health mission, which is going to be digitizing the entire ecosystem surrounding health. We are going to be providing unique health ID to our citizens. We are going to be providing, having a registry of doctors. We are going to be having registry of all our health facilities, and we are going to be creating electronic health records and personal health records, which will help in terms of improving the quality of services. It will be making services more accountable, at the same time providing data for analysis and for better policies. Third thing that has been the theme of this forum so far is that we have to focus more on better coordination and cooperation among countries, including, of course, neighboring countries, but globally. We need to have more effective systems for sharing of information and data. We have to have more effective system for more coordinated surveillance and sharing of research outcomes, including data on vaccine development. These international public goods should be shared systematically through stronger regional cooperation mechanism and also global cooperation mechanisms. We need to institutionalize sharing of knowledge between countries, including between India and UK. I believe we can learn a lot from each other in areas of both digital health, and healthcare reforms, including universal health coverage. We see NHS as a great model and established model, and there are many lessons that we can learn from NHS. At the same time, as Professor Raghavan mentioned earlier, UK probably can have some lessons from us in terms of digital health. Just to conclude, as Churchill famously said, never let a good crisis go to waste. Let us all resolve to combat the current crisis and not let it go to waste. We should resolve to build back better and come out of it much stronger and resilient. Thank you very much for inviting me.
Thank you, Dr. Bhushan. Very encouraging words. And I would even say that the UK-India healthcare collaboration is a building block for global healthcare collaboration. Now we would like to invite someone who is providing leadership to an NHS trust here in the UK. In a personal capacity, he has been visiting India, supporting healthcare ventures in India, and has also initiated a unique framework for sending British trainers to India to help train the workforce, which can then serve in India and also come to serve in the NHS. David Heighton, Chair, NHS Trust, Maidstone and Tunbridge.
Thank you very much. It's an honour to be speaking on this panel. I have two personal perspectives to share. Firstly, as a relatively modest investor in an Indian healthcare company in my past, and secondly, as chairing a hospital which has recently recruited more than 250 Indian nurses in a number of different ways. My exposure to Indian healthcare actually started 15 years ago in Fortnum and Mason's, where I had afternoon tea with Dr. Reddy, Sangeeta's father, and I subsequently had a very fruitful visit to Chennai and Delhi to visit Apollo hospitals, and I was very impressed by what I saw, including telemedicine back to Dr. Reddy's home province, a village in the home province which was not very well served by healthcare. And subsequent to that visit, also had some interaction with Apollo Health Street based in Hyderabad, and very impressed by the Indian healthcare IT. So that gave me a context. So by 2010, when a UK colleague of mine who's originally from India formed a company, I was a modest investor and a director and shareholder in Clearview Healthcare, which was trying to bring in therapeutic and diagnostic capacity in some of the newly emerging Indian hospitals. It was so successful that we had to find, we were a relatively modest group of investors, and to progress at the pace, we then found a joint venture partner, Medipass from Italy, and that then formed Clear Medi Healthcare. And that has brought linear accelerators and radiology equipment into a number of hospitals, and quickly ended up with that company, in some cases, running the radiology department of those hospitals. And the modest group of investors exited in 2014 and sold our shares to Medipass. So I'm really pleased to see how well Clear Medi has done since then. And I think it's really important that the emerging hospitals had the access to the most up-to-date medical equipment. As an investor, I found it actually relatively easy to invest in India and to pay my Indian income tax when I exited under the UK-India reciprocal tax agreement. So although it wasn't an enormous amount of money compared with big corporates, it was actually a relatively easy process. And I think it is important that those types of structures are in place to allow commerce to exist between the two countries. I was working in Qatar in the Middle East for some time, and obviously there interacted with a lot of healthcare colleagues from India. I have to say, one of my visits for Clear Medi to Delhi was, it did require me to get a visa from the Indian embassy in Doha, which must be about the most busiest building I've ever been into. And I do heartily recommend the online visa process that's subsequently taken its place, which I think has made travel between the two countries much, much easier. That sounds like a small point, but I think 10 years ago it wasn't. So that's really important, that the tech has got into government as well as healthcare. Since coming back to this country, the UK, in 2017, I've chaired Maidstone and Tunbridge Wells hospitals, and as I said, in the last 2 years we've recruited about 250 nurses from overseas, principally from India. And it can be difficult for those nurses because when they arrive in the UK they're not registered by the UK, so they have to work at a pre-registration grade, earning less money, and they don't have the responsibility that they're often used to at their home hospital in India, where many of them have been at nursing level for some years. And it can take 3 months to get through the objective structured clinical examination, OSCE, and it can be quite pressured time for them. So when I met again with Dr. Balian, who works for ClearMedi, and his wife, who is also a doctor, we came up with the idea that why didn't we set up a training facility in India that would enable the nurses to be ready for their OSCE when they arrived in the UK. So the idea being that they could firstly pass the language examination in India, but secondly, undergo a training program which would allow them to get virtually immediate UK registration and immediately earn the salary that they wanted to earn and work at the grade they wanted to work at. And we undertook a pilot of 40 nurses, and that has been relatively successful. The company's established in the UK now to enable that to happen, Aryavrat Healthcare. And to facilitate that to happen, we sent some of our professional standards team from the trust to India to help set up the OSCE training program in India. And that's now led to the development of the Sharkos Learning Centre in Mysore, where there are, I think, 3 British trainers and 3 Indian trainers helping those nurses be ready for their OSCE examination. And most of them have that examination booked on their 3rd day in the country. Now, they didn't all pass on the first day. Some of them failed 1 station and had to go back shortly afterwards. But and I know that the training program is being adapted so that they are more likely to be able to pass on the first go. But they all passed most of them passed within 3 days of arrival and were able to go to the ward and work with new colleagues as a registered nurse. However, the issue, whether you come OSCE ready or whether you have to wait for the 3 months of training in the UK before sitting the OSCE exam, it is still a cultural change for those staff. And one thing we've learned as an employer of 250 new staff is that the onboarding program has to be very active. You need to recognise those staff are making a significant change a third of the way across the world to work in a different environment, and providing them with support, accommodation, buddying and mentor relationships to enable them to be confident about their practice from day one is really important. And to connect them together so some of their colleagues who've come before them can be really helpful in supporting the new arrivals. And I think you just really have to work at that to make it effective.
Right.
So that's
David,
all I
I'm
wanted to
conscious
say.
of time. I'm conscious of the time, so I would like to come back to you during the interaction. And
Okay.
that would be an important part because you see, I am a diplomat by profession, but I'm a physician at heart. So I would like to raise the temperature of this virtual room during the course of the interaction. So thank you so much. Thank you, and I'll come back. I'm absolutely convinced that this would inspire, the way Tunbridge, Maidstone and Tunbridge Wells is working with its Indian counterparts. This would inspire other NHS trusts to similarly build partnerships with their counterparts in India. Now we'd like to bring in someone who brings a wealth of private sector perspective, being the joint managing director of Asia's largest corporate healthcare service provider, and also in her role as the current president of the Federation of Indian Chambers of Commerce and Industry. Before I invite Dr. Sangeeta Reddy to share her views, I would like to pay a tribute to the extraordinary work being done by Dr. Pratap Reddy, the founder chairman of the Apollo Group, who is not only a pioneer of private healthcare sector in India, but he has been a pioneer for collaborations of India with other health systems, including in the UK. Dr. Sangeeta Reddy.
Namaste and good afternoon. It's a great pleasure and a privilege for me to share the stage with so many accomplished people, and I thank you for this opportunity. I truly appreciate your acknowledgement of my father, who has laid the foundation in all of us, a foundation of service, a foundation of commitment to patient care, of pioneering spirit to find a new way, and definitely a certain never say you can't do it spirit. And I think that's really what has held us in good stead in these difficult times with COVID. I want to just in a line explain the Apollo Health System. We started in 1983 after my father, who had returned from the United States, and he's worked in the UK as well. But he returned from the United States and set up a cardiology practice. At that time, India had no credible heart surgery program. And so one day he lost a young man who didn't have enough time to get his visa to go to the United States or raise enough money. And that day he said, Indian doctors are curing and caring for people all over the world. Why don't we give them the infrastructure to do so in India? And that was the birth of Apollo. Today we are over 10,000 hospital beds. We have about 250 clinics, 3,600 pharmacies, 2 medical schools, 15 schools of nursing, inputs in technology. But everything we do is towards patient service and towards creating a more accessible, affordable, and a quality healthcare system in our country. We've been privileged to serve over 150 million people from over 120 countries over the last 36 years. Our COVID response, we added beds, we innovated to convert hotel rooms with the telemedicine overlay for the non-critical COVID patients, because in India, isolation is not so easy. Sometimes 5, 7, 10 people share a room and a single bathroom. So we realized that that would, complicate the whole scenario. So we created what we call stay isolated. Stay in a hotel facility or stay at home has become a major success story because of the telemedicine layer. And at this point, I want to thank Mr. Indubhushan and the Indian government. Mr. Hugh, thank you for David Heighton. Thanks for mentioning your visit to Apollo Delhi, where you saw the connection with my father's village. That was done 20 years ago. But over the last 2 months ago, the country formally passed the Telemedicine Act, which we had been requesting on, working for, and now telemedicine has really become mainstream in our country. You can visit a GP over teleconsult. You can see a doctor 24/7, but you can also have a high-end, high-quality tumor board review or get a second opinion service from a very well-qualified neuroscientist. And you can do that at 1/10 of global prices. So I believe the skill and the capability of the Indian clinician is now going to be available all over the world. And we look forward to a major scope of sharing this capability with the world. Now, in the paradigm of health, changing the health paradigm and collaboration, I want to quickly just say 3 or 4 things because I know many of these are thoughts which could be explored by the very well qualified and the people who are on the platform and in the audience. The first one I really want to share about is a continuation of the discussion in terms of manpower. India has a significant number of young people, about our demography, but approximately 11 million people join the workforce every year. And healthcare is one of the most underserved area. I would request that we find ways, innovative ways, like was spoken by Dr. Heighton, Mr. Heighton on the OSCE training, but even more. We actually have taken up a campus in Crewe. We believe that we can create a global paramedical training center or finishing school. So youngsters from India and other parts of the world could come to UK for their final certification, because to study there for 2 and 3 years may be expensive. But if we could create a fast track which accredits the Indian educational institution, does a 1 to 2 month training or a finishing school, and then does the enabling examination, our ability to provide most critical manpower and women power, the human resources to the world would be tremendous. So I talk today not just about answering NHS's requirements, but really about answering the global need for qualified healthcare people. I believe this is a powerful collaboration we can build. It's a multi-sectorial discussion we need to have. It includes e-learning, it includes certification, it needs help about visas, it needs change in the laws. So I'm glad our ambassador and other bureaucrats are here. But when done well and put together, it can be transformational to the healthcare system in terms of accessibility and affordability. It can be transformational in the lives of these young professionals. And it can be transformational in the lives of patients who will get this power. Because we must also remember that care is shifting from the hospital to the clinic, from the clinic to the home, and from the home to a 24/7 ubiquitous access to care. This mobile technology and IOMT-led transformation also opens up multiple IT as well as device collaborations that I would really like us to talk about, because again, it can impact quality, affordability, and accessibility. If we can manufacture, if we can partner, and if we can give interpretation of these services at 1/10 the prices, but most importantly, if we can detect and screen early, the truest paradigm of what we're talking about will be if we build and design a healthcare system versus a sick care system. And by this, I mean early detection, continuum of care, appropriate care in the appropriate setting, enabled by technology. And here, Apollo would be happy to partner. We have a remote care division. We're currently doing thousands of teleconsults, but also innovating on a platform to connect devices, in searching for the appropriate device and building continuum of care and condition management modules. Just to state one case, in our diabetes module, 86% of our diabetes patients brought their HbA1c under control within 90 to 120 days. Medical people on the panel will understand the implications in reduction of cardiac, strokes, diabetic, ophthalmology, and all other related problems of this dreadful metabolic disorder. We can work together, we can partner, we can innovate. I'm not talking too much more because of the lack of time, but we're already working with Isana Biosciences on clinical trials. We're working with Behold AI on artificial intelligence for interpretation. We're also working with other universities, including the Buckingham University, and we look forward to a powerful phase of working together to bring healthcare to the world, because that's what we are capable of. And it is this human spirit of endeavor to serve others that I think will achieve over everything else. And it is with that spirit that I look forward to continuing dialogue with many of you. On behalf of FICCI, which is representative of the industry, I also reiterate that our manufacturing capacity in India is increasing. Our ease of doing business is increasing. India is now the country making 450,000 PPEs per day, from a country which did under 5,000 PPEs in less than 3 months. So we have that capacity. Let us identify areas of need, methodologies to cooperate, use the technology and the manpower strengths of India, and let's help create a better world for everyone. I will end, I belong to the allopathic system, but I will end by something slightly different that we are beginning to believe in. That if we truly believe in a healthcare versus a sick care, India has another silent gift to give everybody. And that is the power of yoga, meditation in the field of prevention. So let's discover all these skills, these talents, these capabilities, and juxtaposition them with the knowledge of the UK system, which is world renowned and world respected. I look forward to co-creation and to serving humanity. Thank you very much. Namaste.
Thank you, Dr. Reddy. I would definitely come back to you during the course of the interaction after we've heard all the panelists. Just to mention that I had the privilege of visiting the Apollo Buckingham Healthcare Science Center at Crewe, north of England. And I'm very happy that, Apollo clinical trials team is working with the Oxford-based Izana Biosciences. What I would like to also mention is that it is the government's job to provide the ecosystems, the pathways, the support, and the facilitation. But finally, it is up to the private sector healthcare providers like yourself to create partnerships with their counterparts in the UK to do bigger things together. I am conscious of the time and thank you. And the technical team is telling us that, we are running behind schedule slightly. So my request to the other speakers whom we'll be inviting shortly is that if they could keep their remarks concise, and we will get an opportunity to hear from them during the interaction as well. I'd like to now invite the CEO of the University Hospitals Coventry and Warwickshire Trust, Professor Andy Hardy. And just like to mention that I had the privilege of visiting the trust several times, and we have a wonderful relationship. The trust is doing extraordinary work with its counterparts in India, and we do hope to see some of those projects go pan-India so that we can really upskill them. The only one suggestion I usually share with the healthcare leaders in the UK is that whenever you do a project with India, whenever you plan to do something in India, think big, and Professor Hardy is somebody who's already doing that. Professor Andy Hardy.
Thank you, and good afternoon, and thank you for the opportunity to contribute to such an august panel. University Hospitals Coventry and Warwickshire, we're proud to have a multicultural workforce and have a number of international partners in collaborative academic and research projects. A large proportion of our international medical and nursing staff are either from India or of an Indian heritage. UHCW has come a long way over the recent years, excelling in clinical care, leading in areas of research including fertility, cancer, human metabolic and cardiovascular, and we're a major trauma centre. We, as you have just said, Aman, have a number of existing collaborations with India, including signing an MOU with Manipal Academy of Higher Studies, Manipal and Amrita Institute of Medical Science, and Kerala to develop bilateral links to promote education and training by engaging in institute-to-institute partnership. We have an international fellowship program in renal transplant, and we have fellows in interventional radiology, and we're planning on expanding on these programs. Alongside the University of Warwick Medical School, we've collaborated with the government of Kerala and the Tata Trust to set up the first of its kind Apex Trauma Simulation Centre in the capital city of Kerala. Once operational, the centre will provide structured, standardised training on pre-hospital care to over 9,000 professionals, including doctors, nurses and paramedics and ambulance drivers, over a 2-year period, with tangible benefits in reducing avoidable death and disability. I have to say this was made possible by a generous financial allocation of 1.3 million by Tata Trust, and logistics have been provided by the Care Institute of Health Sciences in Hyderabad. We have a number of training education facilities here at UHCW, including the West Midlands Surgical Training Centre, which is a Royal College of Surgeons accredited facility. This training facility provides hands-on cadaveric training for procedures linked to all disciplines across medicine and surgery. It allows us to test innovative technical applications like robotic surgery, in addition to conducting masterclasses allied to live transmission from operating theatres. We have established links, including teleconferences with JITMA, Pondicherry, as well as the Manipal Institute of Higher Education. I believe opportunities exist to widen this scope across special associations, for example, the Association of Surgeons of India, and other universities and medical colleges, enhancing the standards of both medical and nursing professional development for all of us. In addition, I think there's a vast majority to exploring the delivery of leadership and healthcare management for health professionals, using our partnerships with Coventry and Warwick universities. I'll be moving on quickly, thinking about what we've been doing due to COVID, and hearing a number of speakers talking about telemedicine. And we've seen a massive acceleration of the use of telemedicine during this period. And if I think about outpatient elective clinics, our use of telemedicine was less than 5% going into COVID. It's now over 48% of all our clinics being undertaken either on telephone or video. We've been using remote monitoring patient blood sugar readings to reduce the amount of in-person appointments needed for ladies who have gestational diabetes. Our therapist teams have been using telemedicine to deliver advice, education and actual exercise tuition via videos following referral from our trauma teams. I think we have a real opportunity to develop ways in which professional colleagues from India can help deliver some of those telemedicine services. And in order to do that, we're looking at how we can further recruitment. We have established online and virtual interviewing techniques. We have established induction training, so we have common standards and common training for our doctors and clinicians wherever they are in the world, not just here in Coventry. And we're currently working on governance models and performance management processes. So consequently, I see a real possibility for even greater work and collaboration with our Indian colleagues over and above that we're already very, very proud of. So in the interest of time, I'll leave it there, and I look forward to the panel conversation later.
Thank you so much, Andy. Thank you. I'd now like to invite additional CEO of the National Health Authority of India, Dr. Praveen Gedam. He's been supporting the India-UK partnership. He was also able to attend the second India-UK healthcare conference held in Birmingham this February. Dr. Gedam, I'd like you to focus on the partnerships which NHA is building with its counterparts in the UK, the University Hospitals Birmingham NHS Trust, which happens to be the single largest integrated critical care center in Europe, and its NHA's collaborations with other counterparts. Thank you. Professor Gedam.
Thanks, Dr. Aman, for having me here, and thanks to the organizers. As you may be aware, the National Health Authority of India is implementing the Ayushman Bharat, world's largest government-sponsored scheme for health insurance covering 540 million people. And this scheme, launched in 2018, has grown now manifold and has successfully established the wide network of 23,000 hospitals and has provided treatment to for around 11 million treatments so far. And this has helped us set up a safety net for vulnerable section of Indian population who have historically relied only on public health facilities for inpatient treatment. It's worth mentioning that around 2/3 of healthcare expenditure in India goes to private. But when it comes to inpatient treatment, the sector has predominantly catered to upper middle class and upper class of the society. And Ayushman Bharat has been a game changer in a way that it has created a demand shock by providing the capacity to purchase healthcare to 540 million people. And this has brought about a new opportunity for private sector to invest and create health infrastructure and help improve the quality of healthcare in India. I think this is one area where India-British collaboration can grow further. NHA has reached a database which can serve as a reference points and will help the private sector to make evidence-based decision making when it comes to future investments in healthcare. In addition to this, as touched upon by our CEO, Dr. Indu Bhushan, we would like to also brief about the opportunity in digital healthcare, which is likely to play a pivotal role in redefining the ways and means in which healthcares are provided. In last few years, India's financial systems has made great strides in financial inclusion through various initiatives of the government. And we have also seen strong innovation from the private sector in various other sectors like digital finance and transactions, and also India is already recognized as one of the world leaders in the tech space. So I presume that we are at a stage to leapfrog in this sector. The ongoing COVID crisis has also emphasized the role that digital health can play, and India's capabilities, I presume, given the size, economy, the groundwork done so far, and Jan Dhan accounts, Aadhaar cards, which basically are unique identification using biometrics, mobile phones, the three are popularly known as Jam Trinity. It has laid down a strong foundation on which such an ecosystem can be developed, and we at NHA India are proud to tell that we have started the process of National Digital Health Mission, one of its kind in the world. So that and we shall soon be, I hope, hope that reaping the benefits of this particular initiative. NHA has been in discussion with UK counterparts, particularly University of Birmingham, and we have already identified areas of mutual collaboration, as has been explained by Dr. Aman Puri, and we look forward to collaborate further. NHS UK has been the flag bearer of providing healthcare and has rich experience of over 7 decades and has implemented several innovations in digital health space through their vertical spine, NHS spine. I think we can collaborate further, and given our respective strengths and experiences, I feel two countries are in a position to enter into a close working relationship in the healthcare, including infrastructure strengthening, capacity building, and digital health. And this is going to help not only the two, but also lay down a path for innovations for the rest of the world. I think with that, I will conclude my couple of words and thank the organizers once again for inviting me to this August gathering. Thanks.
Thank you so much, Dr. Gedam, and wish you all the best for the partnerships you're developing between India and the UK. I would now like to invite Karamjit Singh, Chair, University Hospitals Leicester NHS Trust, one of the largest trusts in the Midlands and also in the UK. Karamjit, I would just request if you could particularly focus on some of the upcoming projects, some of the areas where you feel a complementarity between UK and India, and we could discuss some of the other points during the interaction. Karamjit Singh.
Sir Karanjit, you're on mute.
Yes.
Sorry. I beg your pardon. I just realized. Yeah, sorry. It's a great privilege to be part of this panel. I'm the child of migrants. My father came in the 1930s to this country. My mother came in the 1940s. But we've maintained that link with India, and at least once a year, if not twice a year, I try and go back to the Punjabi village and live in the house that my great-grandfather built over 80 years ago. So I think that, yes, we are a large trust. We have over 2,000 beds and £1 billion annual operating turnover, 16,500 staff. 36% of our staff are from minority ethnic groups. Mainly, a large component of those are from Indian heritage. And we have a very close relationship with our local university, which has been ranked as 5th in the UK and 20th globally in terms of the Shanghai Global Rankings for clinical medicine. So many of those researchers are clinicians in our hospitals in areas like diabetes, cardiology, and respiratory diseases. Now, the largest number of volunteers in the UK were recruited in our hospitals as part of the clinical trials for dexamethasone, and many of our medical staff were part of that research team. And of course, all of you will be aware of how that particular use of that medicine has reduced deaths, mortality by up to 1/3 on ventilators and up to by 1/5 on oxygen. And we've just received funding for a national study for a joint university hospital venture to research the long-term impact of COVID-19 on patients. And we'll be doing this by analysing advanced imaging, data collection, analysis of blood and lung samples. Now, how can we collaborate together? I think there are 4 key areas. One is the human bridge that already exists between our medical and nursing staff and India. So we have consultants doing voluntary medical work in India, supporting medical charities and hospitals. They're teaching their professional development in institutions in India, hosting trainees from India. And we can clearly scale this up and create institutional partnerships. And we want to do that very much because a number of the speakers have talked about national initiatives. I think we need to develop institution-to-institution relationships. I think that we also feel we can share our experience of physical reconfiguration of estates. We've recently been announced that we will be receiving 450 million to reconfigure our physical estate, and particularly issues like environmental sustainability, the planning of this, the digital capacity, the use of space. We think that's something we can perhaps learn from India as well as share. The third area is that we've been talking about the immediate COVID-19 crisis, but we need also to think about restoration and reset of services and how we can learn from each other, and also how we plan for some ongoing pandemic capacity. And our current ambition, let me say, is to make 70% of our outpatient clinics focusing in telemedicine. Now, for us, that is literally 1 million outpatient episodes a year. So we're talking of 700,000 of those being undertaken by telemedicine. And we already are in the 50% plus category, so we will be moving to that rapidly. I think the fourth area is collaboration through research and clinical trials. We feel that this can be scaled up, and when you think about the diversity of the population we have, that we serve 1.3 million people through our hospitals, we feel that there are clearly links in terms of, and we have a section that was involved with 100,000 genome project as well. So we clearly have, those sort of linkages there. So in concluding, I mean, I've witnessed the evolution of the UK-India partnership in health over the past 3 years. I look forward to us hosting part of the annual UK-India Health Conference next year. And I also want to say that this is not a one-way relationship. I believe here in the UK, we can learn a lot from India, particularly in terms of how Jugaad innovation is being applied in the health sector, in terms of how can you bring simplicity, how can you raise quality, and how can you become more efficient. And I believe that the NHS can learn from India as well. Thank you.
Thank you so much, Karamjit. Thank you so much. Without sounding unfair, I would just request the next two speakers to please stick to about 2 minutes each so that we have time for a quick final thought from each of the participants during our interaction. I'd now like to invite Roshan Chetty to talk a little bit about his views on the route of mergers and acquisitions between British and Indian healthcare companies as a route to support the long-term value creation between the two economies and to support collaboration. Roshan Chetty.
Thank you, Dr. Raman, for giving me the opportunity to kind of be amongst the panel members who are an elite set of actually individuals in their own rights. Coming to the topic that you have actually asked me to give my view on. Firstly, I feel that the pharmaceutical and the medtech industry in both countries is very complementary to each other in terms of their focus, competencies, and innovations. While the British companies are heavily invested to innovate into novel medication, the Indian pharma industry is leading in improving access to healthcare at scale with leadership in manufacturing and innovation on generics. And in my view, in order to deliver a sustainable healthcare kind of economy, both of these factors are very, very important. I think with the large software talent pool and the vibrant kind of ecosystem that you have on startup, the huge potential to accelerate on technology and lead transformation in healthcare systems is of prime importance. And I think many of the panel members have actually talked about digital health being kind of very important. So tapping into the talent and the startup community to bring new opportunities from both the British and the India pharma and medtech companies will be very critical. In terms of your question related to the mergers and acquisitions, I have a slightly different kind of perspective in terms of the opportunity that it presents. While the large companies will find synergies, no doubt about it, but I think the long-term opportunity is to collaborate into the startup companies and to actually invest in bringing the speed of digital native to achieve disruption at scale in the pharma and medtech industry. And I think if we prepare this ground, then the mergers and acquisitions at a later stage will actually kind of make immense kind of importance.
Thank you, Roshan. Thank you so much. I'd now like to quickly break in Madhukar Bose, who is the digital lead for Department for International Trade. Madhukar, if you could quickly share your thoughts on how the partnership is building.
Thank you, Aman, and I'll make it quick. I think we've touched upon a lot of things already, but I just wanted to summarize 3 areas where I think the COVID response can come together as a collaboration. The first is in the area of public health, and I think this is where the UK has leveraged its digital assets, such as the NHS website and the relatively new NHS app. And we have seen how India has leveraged the Arogya Setu app to create an entire offering around public health to its citizens. And I think there's a lot of knowledge sharing and lessons that we can learn. In not just innovation, it's not just about creating new things, but it's how you take what you have and really maximize its adoption and use. The second area that I wanted to talk about was this entire area of remote management. And I think that touches upon a lot of things, starts from the first contact that a patient has with the health system. So the NHS moved towards this philosophy of total triage. No matter whether you are contacting a GP practice or a hospital trust or whatever it was, you had to first undergo a set of questions that identified your need and routed patients to the right part of the health system. And this has been absolutely key. It has been automated, and so there's an element of sort of AI and intelligence built into that, which is absolutely key. And that AI again is a key theme that goes across this remote management layer. Sangeeta mentioned Behold.ai. It's one of those really fantastic techs that has adapted itself to COVID-19. We started off with a chest X-ray, general chest X-ray kind of management for cancer, and then moved into COVID. And the last bit on the remote side that I wanted to highlight, I think tele consultations and video consultations we've discussed, and other people have expanded on. I wanted to talk about prescribing and medicine. So e-prescribing has been one of the key pillars for the UK's remote experience, because patients can then be prescribed drugs, they can take those drugs or receive those drugs from any pharmacy of their choice in their local area, rather than having to go all landing up in the same place. The third and last area that I wanted to highlight is around data. And data underpins a lot of things. We have seen how data has been utilized to identify vulnerable patients in the UK and proactively manage them. Data has been used to identify patients for clinical trials. So you have some national clinical trials like the Catalyst trial and the Accord platform recovery trial. All of these has started really using the power of data and power of automated identification of patients to rapidly accelerate clinical trials, but also deliver them at a fraction of the cost that it would normally have. So there are a lot of areas to potentially cover, but I wanted to just focus on these as 3 areas that I think, and the underlying themes of public health, remote management and data that we can use to collaborate and build a wider participation on. Dr. Gedam has mentioned some of the areas, and I think we look forward to take the dialogue forward with both the public health system, but also private providers. And obviously, Sangeeta needs no introduction on that side. So I'm very, very pleased to be working with all of them.
Thank you so much, Madhukar. Thank you. Really appreciate your inputs and the support you've been providing to this partnership. In conclusion, what I would like to say is that for this specific health session, we had done the Consulate of India in Birmingham and FICCI UK had created a paper called Partners in Healthcare UK India. What we'll do is we'll circulate the paper again, and we will invite some of the points which have been raised and the inputs which have been raised by the distinguished members of the panel today. We will build on that paper and eventually distribute it as an outcome of this healthcare collaboration session. With these words, I would like to thank each and every member of the panel, all the viewers sitting in different parts of the world who have been supporting the healthcare collaboration, and a special word of thanks to Right Honorable Matt Hancock, Secretary of State for Health and Social Care, UK, and to India Inc. for organizing this event and giving us this platform to discuss healthcare collaboration. Thank you so much.
I'm Manoj Ladwa, and I have the privilege of being the founder and CEO of India Inc. At India Inc., we pride ourselves in producing incisive content, engaging global leaders, and hosting impactful conversations. At India Inc., we believe in winning partnerships by sharing amazing ideas and exploring great opportunities. We believe in the power of shared values and shared ambitions for a better tomorrow. So welcome to India Global Week, where India meets the world and the world meets India. Enjoy the discussions and let's all be the revival.
And a special welcome from me as well to day 2 of India Global Week. My name is Edie Lush, and I'm the host of this particular digital stage within the conference. We have seen such an incredible response to all of our speakers that have spoken with us, but especially Prime Minister Modi yesterday, who praised the amazing work of India Inc. in bringing India's opportunities to a global audience. And that global audience is you who are listening. We have people from 69 countries and growing, and over 10,000 registered participants. We've heard from UK Health Minister Matt Hancock, from the Home Secretary Priti Patel, and I would encourage you to continue to share what you hear on the social channels. Use our hashtag #BeTheRevival and do tag us, India Inc. Corp. So today, and this session now, in a moment where nationalism is rearing its head, and a lot of people are talking about a very strange concept called globalism, global supply chains being localized, we're going to take a look at the strategic relationship between the UK and India. This very high-level dialogue is going to feature input from Tata, as well as senior parliamentary figures on the broader strategic relationship between India and the United Kingdom at a really important moment for both countries, post-Brexit, and as India looks to strengthen its globalized agenda. We'll look at China, how both countries should engage with this rising power, and issues around COVID-19, Hong Kong, and Huawei. We'll look at defense and security cooperation, and we'll look at trade, investment, and the movement of people. So in just a moment, I'll be pleased to introduce you to your host for this session, for this panel, Lord Gaudia. But first, we have a special message for you from Tim Jones, the Executive Director of Tata Limited.
Good morning. Good afternoon, good evening, good night. Firstly, I'd like to thank Manoj Ladwa and the whole India Inc. team for organising this fantastic event, Global India Week, and a big welcome to you all to this part of the event. I'm very sorry not to be able to join you live today, but having attended in the past, I know the day will deliver a great level of debate and discussion, as well as opportunities to begin or deepen long-lasting relationships and create meaningful action. Manoj, as ever, has attracted a stellar cast of participants from across business and politics, and I'm proud to be representing Tata Group as a platinum sponsor this year. A great deal of time and effort goes into organising an event of this scale, and so I'd like to thank the organisers, India Inc., for being so flexible in pivoting to deliver Global India Week virtually this year, given the restrictions we all face through the pandemic. Who would have thought, as we sipped cocktails in the gardens of the Latimer estate at last year's event, that the world would this year be wrestling with a global pandemic that has tragically already taken 500,000 lives and massively disrupted the global economy? Who knows, but perhaps we'll be able to be back in the Latimer Gardens next year. This next session was originally due to be a parliamentary lunch, and I hope you'll agree that while some delicious food enjoyed across the table from each other would have been rather special, it's great that we've been able to redirect the resources it takes to deliver such a lunch to charitable causes in India and here in the UK. Together with India Inc., we've been able to provide more than 2,000 meals in total to those less fortunate than ourselves, in the UK with our charity partner Save a Day, and in India with our charity partner Taj Public Service Welfare Trust. Like most, we find ourselves in uncharted waters at the moment, and I've been humbled by the many selfless acts of kindness I've seen as the world tackles COVID-19. As the UK begins to open, I believe that those who will thrive after this period are those who've been able to face into that disruption and accelerate change. Both India and the UK have the opportunity to do that. At Tata Group, the UK is arguably our second home. We employ over 60,000 people here, and since 2007 have invested over $15 billion. Globally, the Tata Group comprises around 100 operating companies, playing critical roles in almost every aspect of people's lives in India. While here in the UK, Jaguar Land Rover, Tata Steel, TCS, Tata Chemicals, Tata Consumer Products, Tata Elxsi, the International Hotels Company, Tata Communications, Tata Technologies, Tata Motors and others continue to meet their customers' aspirations for outstanding products and services. Tata has a deep and historic economic and cultural relationship with the UK, one that embodies that of UK-India partnership, and one that I can believe can flourish as Britain's position evolves, both geopolitically and economically. Across our group, we're seeing varying levels of impact from COVID-19 as we navigate towards the new normal. But one thing that remains constant is our commitment to UK-India relations and to future partnerships that will hopefully see both markets prosper economically and culturally. The UK and India have enjoyed a trade relationship that dates back hundreds of years, and in more recent times enjoyed an exchange of people, culture, resources, skills and education. And while our geographies may be far apart, the pandemic has accelerated the use of digital technologies and bringing us closer than ever before. Changing consumer preferences have meant that many organisations have been forced online. The workplace economy has changed forever. You'll hear from my colleague Amit Kapoor from TCS shortly about their innovative employee remote working strategy. In many sectors, digital channels have gone from being nice to have to being primary and in some instances the only available channel. From buying cars and home appliances and in many other categories, digital showrooms that are easy to use are quickly gaining traction with customers who want to remain safe and healthy. We are all navigating towards a new normal. And large corporations are waking up to their community obligations. This means turning CSR and ESG policies into action, helping with post-pandemic reconstruction for our employees, the communities and the partners we work with. Tata has a long history in this regard. For more than 100 years. 2/3 of the dividends generated from our portfolio go to the Tata Trusts, the philanthropic charities that have supported healthcare, education and community development across India. These responsibilities today are more important than ever. As a group, we're constantly looking for synergies. This is part of our chairman Chandra's vision of One Tata, and we're creating platforms where several companies can work together and participate across the globe to help scale and meet opportunities quickly, or to better our social impact. We may be large, but we can also be nimble. I believe that central to our success moving forward is the high levels of cooperation and collaboration at the core of our group culture. In that vein, today is also about collaboration, the opportunity to convey and develop ideas, start conversations, and develop actions for our great nations. Thank you again to the organisers, and I wish you a very enjoyable, stimulating and successful event.
Tim Jones there, the Executive Director of Tata Limited. So now it's time for me to introduce you to your host for this next session. Very pleased to welcome to the digital stage Lord Jitesh Gadhia, a member of the House of Lords, also known as Baron Gadhia of Northwood. Lord Gadhia is one of the key figures who has helped to strengthen UK-India relations and has been associated with some of the largest investments between the United Kingdom and India. Over to you now, Lord Gadhia.
Thank you, Eddie. Good afternoon and welcome to this special session marking the second annual India Day in the UK Parliament. It was my privilege to host the inaugural UK India Week lunch in the House of Lords last year, and it was very much our intention to make this a regular fixture in the parliamentary calendar, celebrating the important relationship between our two countries. This year, I'm delighted to see this event go both global and virtual, perhaps a small silver lining to the current pandemic, allowing us to include over 10,000 participants from more than 69 countries around the world, and covering every aspect of our partnership with India. As we just heard from Tim Jones of Tata in his video clip, the lunch itself has taken on a new form and meaning, with the provision of more than 2,000 free meals for those less fortunate across India and the UK. And I would like to thank Tata for their generosity in supporting such a worthy cause, and also appreciate the support of our charity partners, Taj Public Service Welfare Trust and Sevade. Alongside me at this virtual lunch, I'm delighted to welcome some old and new friends. My colleague, Lord Tariq Ahmed, who is Minister of State responsible for South Asia, the Commonwealth and the United Nations. Also, Her Excellency Gayatri Kumar, who has just started as the new High Commissioner of India to the United Kingdom, and Amit Kapoor, Head of Tata Consultancy Services in the UK and Ireland. Before exploring how we can further deepen the strategic partnership between UK and India and take our collaboration to the next level, I'm delighted to start this session with a special message from the first Secretary of State and Secretary of State for Foreign and Commonwealth Affairs, the Right Honourable Dominic Raab, MP.
Hello, and thank you for having me as part of India Global Week. COVID-19 is a global challenge, and the UK has been proud to stand shoulder to shoulder with India in our international response. As we've responded to this crisis, we've been privileged to have 25,000 Indian professionals working in our brilliant NHS service here at home. We hugely value their contribution. And with India's help, we were able to obtain vital supplies of paracetamol at the very height of the crisis, which has been critical in the fight against COVID-19. Over recent months, we've brought home British nationals from India. We've worked closely with the government of India to get Indian nationals back home safe and sound. And throughout the crisis, we've worked together. So I want to thank the government of India and my colleague and friend, Dr. Jaishankar, for their invaluable assistance in this extraordinary effort. As leaders in the international response, the UK and India have also co-authored the G20 Action Plan, providing an immediate package of $200 billion of global support for the most vulnerable countries right around the world. Even before COVID struck, Britain was India's second biggest research partner, with our joint research estimated to be worth £400 million by 2021. And with India's contribution to the recent Gavi summit on vaccines, together we smashed the target for funding with $8.8 billion raised. But we've got the potential to do even more. A vaccine created by British scientists and manufactured in India, if successful in clinical trials, would have the potential to reach 1 billion people across the developing world, thanks to Oxford University and India's Serum Institute. That would be an amazing achievement, benefiting not just British and Indian people, but making it accessible for the most vulnerable people right around the world. So working together, we can make it happen. Beyond the immediate challenge of COVID, the friendship between Britain and India is strong. And we want to take it to the next level. Our trade relationship is growing, bolstered by entrepreneurs, business founders, and innovators. It increased by nearly 10% to over £24 billion in 2019. We issue more skilled work visas to India than the rest of the world combined. And the number of Indian students in the UK has tripled in the last 3 years alone. Bound by our shared aspirations and ambitions, Britain and India will be energetic champions of free trade to boost small businesses, to cut the cost of living for consumers, and to create the jobs of the future. And we also believe that our friendship with India will be crucial as the UK fulfills its ambition to be an even stronger force for good in the world. When the UK hosts COP26 in 2021, we'll be key partners in tackling climate change. As India returns to the UN Security Council next year and takes up the G20 presidency, I look forward to deepening our cooperation on international issues right across the board. Bound by the depth of our friendship, we will look to India as key partners, not only in our response to this current crisis, but as we build back better and stronger than ever before. Britain will continue to be a part of India's success story, and I know India will continue to be a part of ours. Thank you.
I'm very grateful to Dominic for that thoughtful message, highlighting the many dimensions of our collaboration across pharmaceuticals, vaccines, research, trade, students, climate change, multilateral forums and more, especially his concluding comments about sharing in each other's success. As you also heard, during this COVID crisis, the Foreign Secretary has maintained a close dialogue with his counterpart, Dr. Jaishankar, who will be addressing this conference tomorrow afternoon. And indeed, our Prime Minister, Boris Johnson, has similarly maintained regular contact with Prime Minister Modi throughout this period. The adversity of the pandemic has brought our two countries closer together, and that same spirit is important as we emerge into the next phase of living with COVID whilst fostering a strong recovery and revival. With that backdrop, if I could turn first to my colleague Tariq Ahmed. Yesterday, Prime Minister Modi inaugurated India Global Week with a series of remarks about India's ambition and world outlook. There was one comment which struck me as being very significant, namely his clarification about India's openness to foreign trade and investment. He said that Atma Nirbhar Bharat, or self-reliant India, and I quote, is not about being self-contained or being closed to the world. It is about being self-sustaining and self-generating. I thought that was an important distinction, and one that very much chimes with the UK government's approach to global Britain. And so I would like to ask you, Tariq, how aligned is the agenda of the UK and India at this critical juncture in world history?
Well, Jitesh, thank you very much, and good afternoon, and namaste to all of you across the globe who are joining us for this extremely important event. And I'm delighted to be part and parcel and play a role in the discussions we're having. But you're right, Jitesh. I think the element of what we've heard from India, from Prime Minister Modi, and what we've heard from Prime Minister Johnson is about looking at undoubtedly what our countries need, but also recognizing the importance of the interdependency of humanity as we find common cause, both in facing up to the current pandemic, but also looking beyond the pandemic. As Dominic just said in his response, we are working hand in glove. We want to strengthen our partnerships in a raft of areas, and the challenges of climate change provide a huge opportunity. When you look at India's leadership on solar, you look at our own leadership here in the UK on offshore wind, well, it's time to bring the sun and wind together, and let's do something together for the benefit of all. But it can't be without doubt, and it would be remiss of me not to first of all reflect on both the sadness and the tragedy that has unfolded on all of us through the pandemic, which is COVID-19. We ourselves in the United Kingdom have been extremely challenged by what we have suddenly found ourselves caught up with. Just before we came on air, you and I, Jitesh, were working and on a lighter note talking about the exchanges of parenthood in virtual schooling, and we now have a greater appreciation perhaps for teaching and teachers themselves. But in all seriousness, as I was going as the minister responsible, and I'm proud and both honored to be holding that position of strengthening our relation with India, the challenge we faced in repatriating British nationals from India, and I want to contextualize that again using the words of Prime Minister Modi when he talked of the living bridge between the United Kingdom and India. That's what the living bridge is. It was that people-to-people link. And yes, whilst they were Brits that we were bringing back home, they were Brits like you and I, who have a rich heritage in India. You know, Prime Minister Modi's often, and I've joked about this before, talked about made in India. You know, descending from a mother born in Jodhpur and a father born in Gurdaspur, I always say I've got a bit of made in India in me. But that link of people to people was what really brought us together. As we brought people back, I pay tribute to, yes, Jaishankar ji for his excellent role, his team, Minister Muralidharan particularly, but also the different chief ministers in places such as the Punjab, places such as near Ahmedabad. When we were talking in Gujarat, we were talking about the importance of local administrations. Had we not had that level of cooperation over what was a very challenging situation for India domestically, we would not have had the success in returning so quickly. And we're not talking small numbers, 17,000 people came back. That was constituting over close to 60% of all the Brits we repatriated from around the world. And therefore, it was right that we then stood with India when India sought to repatriate Indian nationals, not just from the UK, but elsewhere in Europe, to help to facilitate that return. And I pay tribute to the efforts of the Indian administration in their Vande Bharat flights, which not only provided Indians returning home, it also allowed us to deliver our new High Commissioner to India as well. And we developed, as we welcome Gayatri Ji here, it's a pleasure seeing her again, albeit virtually. We were also delighted that Philip Barton was able to take up his new role in Delhi. And we look forward to the important work being outlined already across the economy, across trade, and on working on the COVID crisis. And if I may just pause on that particular point, and Dominic again referred to the importance of COVID-19. I was really quite privileged to help to facilitate that initial dialogue between other Poonawalla of the Serum Institute and AstraZeneca, and through our Department of Health, and Matt was directly involved with that as well. And that showed that how government and the private sector need to come together, work together to find a solution to this global pandemic. And I do hope that that will show that we stand together, not just in the interests of our own people and citizens, but as Prime Minister Johnson and Modi have said, it's through working together on this global pandemic and finding a vaccine solution, that through the Serum Institute, and I know I speak for everyone, we wish everyone success, that we'll be able to provide support, not just for our own citizens, but for many vulnerable people all around the world. So we look forward to a further strengthening partnership with India. There are many people who have a rich heritage with India who today represent the United Kingdom. And I think that lays itself to a very strong and prosperous future, not just for both nations, but as we take our role on the world stage. And may I add formally, again, the welcome of India to the UN Security Council, and as Minister for both the UN and Commonwealth, we look forward to working with India, not just bilaterally, but through multilateral fora as well. Thanks, Jitesh.
Thanks, Tariq. If I could bring in the High Commissioner into the discussion, firstly to add my own official public welcome to the UK. Last year I co-hosted the India Day lunch in Parliament with your predecessor, Ruchi Ghanshyam, and we remember her with much affection and fondness, and it's wonderful to have another very senior female diplomat from India. As you familiarize yourself and get your feet under the table here, what is topmost in your inbox, and what are your priorities in the coming months? I think you're on mute, High Commissioner.
Sorry. Thank you very much, Lord Gadia. First of all, Honourable Minister of State, Lord Tariq Ahmed, thank you very much for your comments. I would fully, reciprocate the warm sentiment, and also fully agree with each and every point that you made. I'm very grateful for the contribution of yourself, Lord Gadia. The fact that today would have been an annual India Day, I think would have been a moment of great pride for me. But I'm also very proud of the alternative program that was quickly thought of, the 2,000 people being fed in India. I think that was a very noble initiative, and thank you for all these wonderful initiatives. The theme of Be the Revival, partners, a winning partnership, reminds me of Mahatma Gandhi's, his motto that we should be the change that we want to see. Somehow that comes to my mind. I'm glad you mentioned the clarification of Honorable Prime Minister on Atmanirbharta, Atmanirbhar Bharat, because this is supposed to actually merge into the global supply chain, into global cooperation for economic reform and recovery and revival. So I am very glad you mentioned that. I also would like to convey on this platform India's thanks for the terrific partnership in which we were able to repatriate 21,000. Some of them were Indian nationals, some British friends, and also Indian nationals from outside the UK. This is the perfect timing for this kind of a discussion, I feel, and thank you for asking me this question. I feel that this is a time that all nations all over the world are actually individually and in groups and collectively reviewing their and rebooting their priorities. This has been a kind of a black swan event, and which has seen also coincided with global geopolitics seeing a sudden transformation. There have been a new set of post-COVID compulsions. We also see in Europe on the economic front that there has been an impulse for reshoring after offshoring manufacture. So that throws up, challenges as well as opportunities. But at the global level, of course, and I would like to mention Brexit, the fact that now the UK would be taking independent, having an independent trade policy is another area which I would call an opportunity. And the fact that we've done a joint trade review and even identified the 5 areas where we would like to push ahead or prioritize, I think that's a great start. I had the opportunity on another panel of, hearing the Honorable Madam Secretary of State for Trade. So her remarks were extremely encouraging, as were the remarks of the Right Honorable Foreign Secretary, the Honorable Foreign Secretary Dominic Raab just now. He and his Indian counterpart, the fact that our 2 prime ministers are speaking and identifying the priorities of India-UK agenda going forward, these are very, very good guidelines for an incoming High Commissioner like me. If I may, I would just like to also say that the fact that India is now in the UNSC and India will be working closely with the UK on some of the very, very important global issues. This brings up, some of the issues on which we have convergence, which will have great importance now because of the emerging, we would be an important voice for the developing world as well. But there are issues like terrorism, security in the world. Climate change is another issue where the UK would find in its presidency of COP26 that India would be a great partner and a great support. We are taking initiatives in solar, usage of renewable energy. Prime Minister has today inaugurated a 750 kilowatt solar project in Madhya Pradesh, which will help to feed the Delhi Metro. I also would like to mention that India would be working with all the G20 countries. December 1 this year, we will be, part of the Troika, although our presidency comes up later. So this again throws up an opportunity for India and the UK to be at the helm of making it a better world, working together on all these issues. Of course, the most important thing that would be a priority for us is supporting other member states who feel the need, like we do, of safeguarding and preserving multilateralism and reform of international organizations to make them more effective, for a rules-based international order, for rules-based international trade with WTO at its center. Now, these are all points which are, very, very, they are highest on our country's agenda. They would be highest on my checklist. And I am already working with, my counterparts in the Foreign and Commonwealth Office who have been most enthusiastic when I've mentioned these priorities. So really, I couldn't ask for more. Thank you.
Thank you, High Commissioner. I hear a very close alignment there. And on that note, maybe I should turn to Amit. You've just heard the exciting ambition from a government to government perspective. So let's explore how that translates into the business world. You represent one of India's largest listed companies by market value, and we heard from Prime Minister Modi yesterday the importance of Indian talent, especially in the technology sector. Your business model is driven by providing solutions using technology talent. What more can UK and Indian governments do to harness this capability?
Sure. Many thanks, Lord Gadia. First and foremost, it's a privilege to join yourself, Lord Ahmed, and Her Excellency the Ambassador on this in this conversation. If I may, just paint a impression of the relationship that we have enjoyed between UK and India on the back of businesses. So UK continues to be most pivotal market as an economy of investment, as an economy of trade for enterprises. In fact, Tim very clearly mentioned of it being a second home to the group. Within TCS, UK is the second largest country market for us globally, with close to around 19,000 of our employees living and working in the country. And most importantly, servicing close to around 200 plus enterprises who are very critical to local UK's economy and its presence on the global business map. Whether it is the leading retailers, whether it is the leading bankers, financial services, or the elements related to individual and citizen experience. So we do have the ability of being partnering with some of the leading businesses in their initiatives. I think coming to talent and technology, I think if we just reflect on last 3 months, what it has taught us is the utilization of technology and the reimagination of technology needs to be driven from a very different perspective. The way we look at technology is not necessarily as a mode of bringing a slight efficiency, but essentially we need to reimagine technology as an underlying fabric, which can deliver enhanced experience towards enterprises, towards society, and more largely towards citizens and governments. I think we need to reimagine the utilization of technology from that lens, and the combination of talent and technology, in our opinion, is the fundamental core to the entire philosophy of Be the Revival, and in fact, lead the change. In fact, in last 3 months, we have been able to industrialize the utilization of technology to over 400,000 of our own employees spread globally, who used to co-locate in our offices largely in India as big campuses, to be distributed across their home as work locations, but still be technologically coupled on the back of these investments. I think some of these are eye-opening examples and just narrate the entire relevance and importance of the scale that technology can deliver to all of us as enterprises, as well as individual citizens and contributors to larger economy. Thank you.
That's great, Amit. If I could maybe give the opportunity of bringing Tarek back in to respond to what you've just heard from the High Commissioner and from Amit.
Yeah, I mean, first of all, I think it's great to see how much agreement there is. I think, we're not sitting down and looking at this, yes, from different perspectives, but the common objective is in front of us. I think you're quite right, Jitesh, to say that it's not just government to government. Government is intrinsically linked with how we work with the private sector. And I think both governments are of that mindset that we want to leverage the private sector fully for the potential it holds. I'm very ambitious because you and I have often talked about this, that when you look at the strength of the British Indian diaspora business, the private sector arm, whilst there are some great names and we've already heard from some of them, the potential is huge to really leverage that more fully. And the High Commissioner is spot on. I think in the post-Brexit Britain, we're finalising all our final arrangements. I assure you there's lots going on. In the midst of all of this, of course, we're also merging the Foreign Office with the Department of International Trade. And that, for everyone listening in, we believe very strongly, the Prime Minister is very much leading on the front, is to align the values piece, which also the High Commissioner talked about in the international forum. So whilst we're talking private sector, is how we work together in the multilateral sphere. So these provide huge opportunities. And as we look forward to 2021, from the 1st of January, the United Kingdom would have completed its transition period of leaving the European Union. On the 1st in January, India will be joining the UN Security Council. We then also have the prospect of the rescheduled Commonwealth Heads of Government meeting, which will take place in Kigali in Rwanda, and of course COP26, which we've all talked about. Now, all these meetings are relevant, but they're also relevant, and they must have, as they've had during London's Heads of Government meeting, a prosperity priority. And by that I mean our private sector must be playing an integral role in all these different elements of what we're seeking to do. We will not be able to achieve our targets, objectives, and ambitions on climate change without the private sector. We will not be able to, obviously, have strengthened trade across different sectors. And we need to move away from perhaps some of the traditional things we've talked about to see new innovation. We haven't touched on the keyword of technology. I remember I've made several visits to India as a minister, but my first ministerial visit that I made was when Prime Minister Modi hosted a cyber conference. And I was amazed by the talent of youngsters. There were children, as young as some of mine, who were coming on stage and meeting the Prime Minister's challenge on cyber security. And I think there's a huge potential. Our Prime Minister Johnson, has talked about the technology partnerships. And when Prime Minister Modi visited London in 2018, this was one of the key priorities we highlighted. So huge potential. The private sector is not separate to, but intrinsic to what we're seeking to achieve. And that, I think it bodes well for, as I said, not just both countries, but globally. And I'm absolutely delighted that we'll be working with India in a multilateral fora as well.
Sadly, we are almost out of time. So in the last few minutes, literally a couple of minutes, maybe I can be a little bit cheeky and ask each of you, by the time we host the 3rd annual India Day in Parliament next year, what one thing do you hope we will have achieved in the next 12 months to look back upon when we hopefully meet in person rather than virtually this time next year? Maybe starting with the High Commissioner. I think you'll have to go. Yeah.
Sorry, I'm sorry about that. I think the most urgent wish of mine is the vaccine project between Oxford and the Serum Institute. So like everybody in the world, our eyes are on that. I also think that climate change is the other big thing. We should listen very carefully to what the experts are telling us, rather than have another, global crisis like we've just had the pandemic. So not to take too much time, but these two would be the things that I would like to see India and the UK work on and take the lead, and we can, and we must.
Well, look, vaccines and climate would definitely be sort of high up on my list too. Next, if I could ask Amit.
Sure. I think the only single point in my mind towards this is to be able to come together and lead the change. The world has opened up not only for challenges, but also for opportunities. And I think this is a brilliant moment for us to lead that together.
Fantastic. And finally, Tariq.
Yeah, I agree with the High Commissioner. It would be great to coming together to find a vaccine on COVID. So COVID, climate, but can only be delivered through collaboration and collective action. High Commissioner, you quoted Mahatma Gandhi ji. He also said the future depends on what we do today and what you do today, what we collectively do. And if I may, it really sums it up really neatly that our actions today will determine our successes for tomorrow. If I could just indulge you, and finally, as the British minister, say to all people, we're proud to be hosting this. I pay tribute to my good friend, Lord Gadia, for his initiative. He, I know, expends a great deal of time and energy in bringing us all together, as he's done today virtually. So I hope, God willing, as a Muslim, I always say, Inshallah, we will meet in person. And I end, if I may, in words of Hindi, कि हमारी प्रार्थना है कि अगले वर्ष हम आप सबका स्वागत लंदन में करेंगे. Namaste.
That's fantastic, Tariq, and a brilliant set of contributions. Thank you to my colleague Lord Tariq Ahmed, Her Excellency Gayatri Kumar, and Amit Kapoor. Thank you for joining India Global Week 2020.
Thank you,
Thank you very much. Stay safe. Thank you.
Manoj Ladwa, and I have the privilege of being the founder and CEO of India Inc. At India Inc., we pride ourselves in producing incisive content, engaging global leaders, and hosting impactful conversations. At India Inc., we believe in winning partnerships by sharing amazing ideas and exploring great opportunities. We believe in the power of shared values and shared ambitions for a better tomorrow. So welcome to India Global Week, where India meets the world and the world meets India. Enjoy the discussions and let's all be the revival.
And a very special welcome to you from me as well. My name is Edie Lush, and I'm the host of this particular digital stage within India Global Week. What an incredible response we've seen to Prime Minister Modi's address to us yesterday when he praised the excellent work of India Inc. in bringing India's opportunities to a global audience. And that global audience is exactly what we have with us here today. Over 10,000 registered participants from over 69 different countries, tuning in to sessions about private equity, pharmaceuticals, the future of relations between India and the UK, India and China, India and Japan, and the United States. So today, we are talking about the future of mobility in a fast-changing world. This is a very special conversation with Bhavish Agarwal. Now, Ola, of course, is a global force in ride sharing. Mobility and the future of cities in a post-COVID world is something that is top of mind for many of us. In the wake of COVID-19, there is an enormous concern in London as well as other places about the safety of public transport and, in fact, how many people can get around in it. We've seen a reluctance for people to get back on the tube here in London and in buses. And there is no question that ride sharing, along with micromobility and shared mobility in general, has a role to play in the future of transport. I'm really looking forward to this conversation between Shraddha Sharma and Bhavish Agarwal. Now, Shraddha Sharma is the founder and CEO of Your Story Media, and that is India's largest digital media and education platform for entrepreneurship. So, Shraddha, over to you now.
Thank you so much, Bhavish. Very excited, as always, very excited, very honored to be talking to you. I have to tell that in India, for most of the young people, when they think about entrepreneurship, when they think about starting up, they think of you. And what an incredible story you've scripted for all of us to look, to admire, to follow. I want to ask you that in our country, we have so many problems in India. How and why did you choose mobility?
Shraddha, thank you. And it's always wonderful speaking with you. And this time on a digital platform. Many times we've met, but this time was the first time on a digital platform on a very important forum, actually. Right. So the question that you asked about mobility, mobility is actually such an important theme for human progress in general, right? Mobility technologies have moved humanity forward since so long ago. If you think of the first industrial revolution, it was all about the steam engine and then the locomotives, and then from there we moved to planes, cars, etc. So human progress over the last many centuries has very closely been intertwined with the evolution and the progression of mobility technologies. The way we trade amongst each other as citizens or as countries or nations, and the way our cities are designed, everything largely depends. Sometimes we underestimate how closely mobility technologies impact our lives, because it's we think it's all about getting from point A to point B. But actually, a lot of paradigms around us are designed basis the mobility technology of the day. And mobility technologies, be it the cars or the planes, etc., these were 100-year-old inventions and technologies. And for a while, there was no real new innovation happening in the field of mobility globally. But in the last decade or so, there's been a convergence of technologies and hence innovations in new age business models, etc. in this space. Mobility, computing, communications, all these technologies are actually now merging and creating very new paradigms, be it what Ola represents to many consumers globally, which is shared mobility, new paradigms in ride sharing, micro mobility, etc. Or be it electric mobility, autonomous mobility, flying cars, what have you. So there's so much to look forward to when we think of mobility. And I, as an entrepreneur, I got into mobility, fairly accidentally through personal experiences of the inefficiencies of moving around many of our cities. But once we, where we are today, when I look forward, our ambition is actually to build clean, efficient, accessible, and safe mobility solutions for everybody around the world. And this mobility revolution is actually just getting started. And I actually believe Ola and in a larger sense, Indian companies can actually build the future paradigms around the world in the field of mobility.
Yeah, Bhavish, I have to say this, and for everyone who will be listening to this, many people appreciate what mobility is. Many people have tried to build businesses in this, but one has to give it to you that, you started so small, and today the kind of business, the kind of space that you dominate in mobility, and you are competing, and I don't know if you'll agree, but you're competing with the best in the world, and you're giving everyone a tough time. And you launched in London this year. So from an Indian startup to now an Indian multinational, if I may say so. Tell us why and how did you what does it take to make this journey, and what has been your learnings?
Shraddha, it's been a very interesting journey. Obviously, when we started off in 2011, we were a bunch of kids in a small room in Mumbai, sitting and dreaming about what all we could do, and not worrying about what resources we had. So from there on, in the first few years, we grew our core ride-sharing business across the length and breadth of India. Today we operate in about 200 cities in India, and we operate many forms of mobility solutions. Cars, two-wheelers, three-wheelers, micro-mobility solutions, public transit solutions, etc., all across the board for the Indian market. But about a few years ago, 2-3 years ago, we were asking ourselves that technology is not about any single country, right? And if India, being the hub of talent and being a large market in itself, can actually give us a springboard to take some of these solutions, business models to many other parts of the world also, and build relevant solutions in those markets. So that's when we decided we would like to expand into some of the other global markets, because our ambition has always been to build global solutions and build globally competitive businesses and global scale businesses, right? And in today's world, it's actually much more relevant if you're playing in the field of technology for you to build globally relevant and global scale solutions. So that's when we decided to expand our core ride-sharing business into Australia, New Zealand, and eventually UK and London. And it's been quite an exciting journey in this kind of an expansion. We were one of the few early consumer internet companies to go global in a large format way. And we actually realized consumers have similar issues everywhere. And if your core technology strength is good, which being an Indian company, building an Indian technology stack, we are one of the best in the world. So if you are solving core technology problems and your business model principles are fundamentally strong, they would be relevant in any market. And we've had a great reception in all of these markets. We've been able to solve local problems, and not just solve from a past perspective, but also move the industry forward globally. For example, when I look at the future of ride sharing in many Western markets, the conversation is actually about, and especially more so post-COVID, how can ride sharing contribute to a much more cleaner environment? How can ride sharing help evolve a future where the reliance on public transport might, for the short term, be less, but yet people don't want to go into personal mobility because that just clogs the roads a lot more. So a lot of new technologies and new concepts are still evolving, and we are driving those discussions forward as a leader on the global stage now.
Yeah, and again, I want to say congratulations on London, because such an amazing aspirational city, and it was so amazing to see Ola and happy Ola drivers. The last photos that we saw. So congratulations. But
thank you so much.
Today, but today, unfortunately, we are talking in a time where mobility has been hit, and how, right? And I want to ask you, what does it mean for you right now? Like, what does it mean now? What will it mean in the new normal and the world that we are going to be seeing? And how are you thinking about this?
That's a very relevant question, Shraddha, and that's a question on top of the entire industry's mind, right? So in the short term, the need of the hour is for citizens to shelter in place so that the pandemic can get resolved in some form or factor, right? And across the globe, there are different ways and forms in which it's getting resolved. But actually, the pandemic puts forth the question and actually makes mobility even more relevant because the need for safe mobility is even higher in times of a pandemic. People will, once the situation normalizes a little bit, will need to move around. People need to move around to do their work, to do local commerce, to trade amongst themselves. So the need for mobility is a constant. And the need for cleaner, safer, more accessible mobility solutions is actually even more relevant. So the onus is actually on the industry to build those kind of solutions, build solutions where the average citizens feel safe to get back going and get to work, to build solutions which are actually cleaner. Since this has been such a big disruption in our normal way of life, the industry can actually take a very different path forward to a much more cleaner, climate conscious future, and move this global industry forward in that direction. And then, we are seeing conversations around the world in this direction. For example, we are actually focused a lot on making sure consumers can trust Ola to be a safe ride to their work and safe and healthy ride to their work. So we launched an initiative called Ride Safe in the UK and actually across all our markets, where we are investing about $100 million to ensure citizens get a clean, sanitized, fumigated, healthy driver, a ride which they can trust to be safe and get them to office without any major issues. So that's one of the initiatives we are doing. Another thing which we see happening in the post-COVID world is the future. There'll be a lot more accelerated focus on by countries and by citizens to make mobility cleaner and greener. If you look at the statistics, about 20% of all global emissions are because of transport. And today, the technologies around electrification are mature, are getting to a point on the cost and technology curve where they can make business sense. So we're already seeing countries, especially in Europe, the European Union, even the UK, and even India actually, taking the lead to nudge the industry and also provide an enabling platform for an accelerated transition to electric mobility. So that's another area where we are also pushing a lot for the future.
Yeah, I know how passionate you are about electric mobility and Ola, how you are ambitious. Ola is also ambitious in terms of the bets and the thinking that you've been making around, and it's not now. You've been thinking about it since last couple of years, and I don't know how much I can talk about it, but one big news which we were very proud of is that you went ahead and acquired a Dutch OEM, right? Two-wheeler OEM, and it's a very beautiful looking scooter company. Tell us, what's your ambition around this? And can we say now Ola is also an OEM now? And what are you thinking? How are you planning this new foray?
Yeah, Shraddha, Ola is what Ola is and what Ola will be. And then the lines are blurred today between what an OEM business model was, etc. So, but let me share how we are looking at the electric mobility opportunity, right? Now, if you look at the world of mobility, there are different form factors of vehicles in the world. There are the heavy vehicles, the trucks, and the SUVs for personal use, and much more so in the Western world, the large sedans, luxury sedans. And then there's a lot of vehicles which are two-wheelers, three-wheelers, small cars, etc. in the world. And if you put a number on top of these, right, then the number of, as you would imagine, the number of small vehicles, be it small cars, two-wheelers, and three-wheelers, far exceeds the number of large format cars sold in the world, and far exceeds in total volume and actually total energy consumed also. So an electric future is incomplete unless you solve from a technology standpoint and a business model standpoint this segment of mobility. So that's what Ola is focused on. We are focused on electrifying the small cars, the two-wheelers, the three-wheelers, etc. And in this space, we want to build technologies relevant across the world and business models relevant across the world. And our acquisition that you briefly mentioned is the start in that direction. It's a very, very exciting Dutch company which has built a wonderful, very beautiful designed and actually good technology and inside it also two-wheeler. So we would definitely be launching that across Europe and bringing that technology into India also. And going much beyond that into, like I mentioned, electrifying three-wheeler mobility, electrifying small cars. So our ambition is to make sure the world is not incomplete in terms of electric solutions. Just solving for large format vehicles, solve for electrifying mobility.
Yeah. I want to again, maybe you've answered, but I want you to go a little more deeper on this. That are you solving, the mobility solution? Is it for livelihoods or is it for lifestyle? And can we have both the product and service in the mobility space?
Yeah, I think that's a very relevant question, Shraddha. Now, Ola, when we started with a suite of mobility solutions, mobility services, right? And we built the four-wheeler ride sharing, then the three-wheeler ride sharing, two-wheeler ride sharing. All those were built on back of the mobility, the transformation happening in terms of how people were consuming mobility. And if I look out into the future, right, the world will not just be only mobility services or only personal mobility. It'll be a spectrum from transport to shared mobility solutions to personal mobility. And our mission is to build the future of mobility for everybody, for a billion people. And hence, we actually will be building solutions all across these paradigms. So on the shared mobility, we're already one of the global leaders. We spoke a little bit about that. But when it comes to personal mobility, now personal mobility is going to be something that people will live with for a long time to come. Now they might the vehicles might become electric, the vehicle designs might change over the years, but all of us need personal mobility to get around and have economic mobility. So we are also focused on making sure we give access to clean, efficient, and safe personal mobility solutions, and that's where the Ola Electric vision fits in.
How are you seeing the world, Bhavish? Because you have been in the trenches building this for last 10 years, and you're taking ambitious bets. How are you seeing the next few years? And we hear of flying taxis, autonomous cars. There's so much happening in the mobility space. How are you seeing this space evolve? If we have to hear from you in the next few years, what do you see?
Shraddha, I think this mobility is one of the most exciting industries for the future. Like I mentioned, the mobility space is getting to a confluence of technologies, be it computing, be it communications, or be it core propulsion technologies, etc. And that's leading to a whole new form factor of how we move around, right? What has happened in the last few years was new kind of mobility services like shared mobility. What will happen looking forward will be, there'll be flying taxis in the right use cases. There'll be autonomous vehicles in different use cases. All of these will, be built on a base of electric technology. It's hard to imagine a gasoline autonomous car going into a petrol pump and filling fuel. That's not going to be the right. So the base for all of these technologies in terms of propulsion will be electric. And then on top of that, you can have a lot of these technologies in terms of, like you mentioned, flying cars. Now, a lot of the technology might be early, but just imagine the kind of infrastructure investments that can save for a country like us if we can build safe drone solutions for goods or people movement. Now, a lot of these technologies are still early, but we definitely intend to play a big role in the entire spectrum of mobility technologies. One more thing I would like to say is the unique context India brings today. 20 years ago, it might have been still very different, but today, India is a place where there's a lot of talent in terms of engineering talent, entrepreneurial talent, managerial talent. There's a lot of energy because it's a young country. And it's also a large market, so you don't need to only think of India as a place you build technology for everywhere else in the world. You can actually build large volume businesses in India and then take those technologies outside India also, which is the journey we have followed. So, the future from an Indian perspective is also to, like our Prime Minister recently said, right, the Atmanirbhar Bharat, which is actually about India integrating into global supply chains. And my own interpretation of that also is not just supply chains of the past, but supply chains and technologies of the future. So, this is one industry where a lot of innovation will happen. And it'll be so exciting to see if India and Indian companies can lead that around the world.
Bhavish, when you're saying this, I just want to say that one very big shift I see in the last 10, 12, 15 years would be that we have our young entrepreneurs like you, if I may say so, ambitious, because at the end of the day, it's the humans, right? Like who use technology and everything. And we have people like you who are so unapologetically ambitious to create impact and to be, to have, if I may say, the front seat ride globally. Right. And that is one question. There are two questions now I have. As an Indian, today, creating a world-class business across the world. What do you see are the opportunities for India as a country? Because again, Prime Minister said something very nice in Hindi, is आपदा को अवसर में बदलना है. So what do you have to say? And I want to ask you something very personal. That's the second question, and I hope we have the time to can finish. Is that if I have to get inside your mind, and everyone watching this has to, I'm sure this has not been easy time for you. This, I am sure, knowing you, you would be 24/7 thinking, planning, doing things. How do you build resiliency inside your own self as an entrepreneur when things around you are far more uncertain than you're used to?
Okay, these are two fairly deep questions, Shraddha. So let me answer the first one. So the first question was, what are the opportunities from an Indian entrepreneur perspective in this changed world, right? See, I think just like our Prime Minister said, that let's turn this period into a period of opportunity, right? The transformation of industries across the world is only accelerated because of this pandemic. It has not slowed down. Technology penetration is only getting faster, and this pandemic has given it a one-time massive acceleration. And I think this is the best time for Indian companies and Indian entrepreneurs to think global in their aspirations, and build for global scale, build for global competitiveness. And the world is actually a very welcoming place to Indian businesses. Our value system is appreciated by the world. India in general has been a very, Indian businesses are well respected for the value system that they denote. And in terms of quality also, Indian businesses, Indian services, Indian technology is again well respected. And this is also now the time where we can create globally leading consumer brands driven by technology. And if you look at all kinds of industries around the world, there are very, very good companies emerging out of America. There are good companies from other parts of the world also. And I think India is at that inflection point where we can build both. We can be a bridge between both the Western style economies and also the developing style economies, because our values are very open and democratic, and our technology is we converse in English. Our technologies are very relevant in those markets also. But also we understand the cost structures of developing economies. We understand the consumer psyche of a developing economy. So we can actually straddle both worlds and create large, globally competitive brands and businesses. And that's something I believe this is the time for all businesses in India, all entrepreneurs to really, bring on the energy and get going. It's a tough time. It's a tough time because, like you mentioned, I'm segueing into your second question now, that these are times when there's a lot of impact on many businesses. Economies will go through a tough time, but there's always, we all know at some point it'll swing back up, whether that'll be a V-shaped recovery, U-shaped recovery, who knows. And frankly, I think the details here are irrelevant. The broader strategic direction is that there will be a recovery. And if we can be optimistic, and I'm an entrepreneur, so I'm fundamentally an optimist, Shraddha, like you and like all of us. Right. So if we be optimistic, it's very easy to be resilient if you just look at the future and hope for a brighter tomorrow. Right. And prepare yourself when there is an upswing. You will be ready to maximize the opportunity.
Yeah, but Bhavish, one question again, I'm going to push you for this, is that, because we all don't get inside your brain, because it keeps on functioning and doing new things and big things. And, and you come from a humble background, you've come from a, like you've dreamt those dreams and you're making those dreams happen for everyone. All of us see dreams. All of us are seeing big dreams, but you're making things happen in a very competitive, in a very global world. Tell me, how do you process things to keep on moving forward constantly? What do you do if people have to take something from you?
I think, Shraddha, you're being very generous in your words for me.
I think life is very real.
Yeah, I think it starts with just having an unconstrained dream, and it's not just me. I think the entire youth of our country is very ambitious, and the young people are what is India's strength and what will move our country forward also in every domain. And if you have a dream and if you are able to be resourceful enough around yourself. Like for example, obviously we have a great team at Ola, which enables, my job is the easiest actually, just to put something on the table and then everybody else has to figure out what to do. So we have a solid team which can translate dreams into reality, because ideas are in the end worth not much. You have to execute them to make them real. So building a culture of execution is also critical. And actually in times of stress like this, it is the excellence you build on a day-to-day basis beforehand which holds you in good stead. And excellence around doing the right thing for the customer, doing it at the right efficiency and the right cost, focusing on quality, all of those things in the end are very important. And if you are standing on a strong footing and a foundation for yourself, then it's very easy to look ahead and dream. You might not fulfill all of them, but at least you will not regret not having thought of those things.
Yeah. Thank you. Yes, agree. And maybe we can get some news questions. Are we going to see more acquisitions? Some newsy question.
Shraddha, we're always we're a fairly broad organization now, and we are present in 2-3 different business segments. So we definitely are always looking out for interesting companies which we can partner with, be it an acquisition, be it an investment. And we've had our share of strong acquisitions, and the most recent one was this electric two-wheeler company in the Netherlands. And we have a global perspective on these things. We definitely are talking. We keep talking to many companies all around. But acquisitions make sense only when there's either some strong technology we can acquire, or whether there's a strong set of talent which we can bring on board. And we've had successes both ways. So we keep looking for them, and at the right time, we definitely will make some of those public.
Yeah, cool. To a global Ola story, and to a very strong, and and to mobility, and like you said, to making mobility easy for everyone. And I hope that Ola continues to write an unprecedented story. Thank you, Bhavish.
Thank you so much, Shraddha. Wonderful speaking with you as always.
Yeah, same here. Thank you.
Thank you.
Did we finish? So many things. How are you envisaged? If you have to look at Ola, there's so many pieces and there's so many things you're doing. But can we say that predominantly you will be focusing on electric?
Shraddha, electric is one part of of what we are focused on. Our what we have built over the last decade is actually one of the world's leading mobility services companies, which is also continuing to be a major area of innovation around the world and a major area of focus for us. But like I said, our mission is to focus on the length and breadth of mobility and build the future of mobility across all these dimensions. Be it shared mobility or new age concepts around mobility services. And those concepts differ when you think of a developing market like India, when you think of a more Western market like the UK. Electric mobility is definitely our focus, and we're in the early days of that industry's industry's transformation, and we definitely want to be one of the leading players in the world to transform that segment. Then there are many new technologies in mobility which we discussed, like autonomous mobility. Things like autonomous. It's not just zero or full autonomous. There's a lot of spectrum in the middle. Actually, a lot of those technologies are not even only for full autonomy and to reduce cost of driving. A lot of those technologies actually enable safer mobility. Even when there's a driver driving the vehicle, autonomous technologies can enable safer mobility. So that is another area of focus for us. We've done some early work in that space. So we are working across the entire paradigm of mobility and focused on technologies which define the future of mobility.
Mm-hmm. And now, this conference is India, UK. I want to ask you how was it in UK? If you can tell us, because I'd seen the pictures and I'd seen the happy cab drivers, but what has it meant to launch in UK?
UK has been a very exciting and actually a very special journey for us. UK is actually one of the most forward-looking, and specifically London is one of the most progressive, forward-looking transportation ecosystems in the world. And not just that, actually also one of the largest markets in the world, and one of the most competitive in terms of technologies, in terms of brands, one of the most competitive. So the challenge in front of us was to build a brand and a service and leverage technologies which truly stand out and which consumers and the driver ecosystem also values. And they believe that this can be the future of this industry. And I actually feel very excited and confident about what work our teams have done there. And so it's still in the early stages. We launched earlier this year only, but we remain committed to building safe, clean ride sharing and mobility solutions for all of UK. And like I mentioned, for example, London is actually taking the lead in electrifying its both bus and taxi fleet. And we definitely want to partner with the governments in London and beyond to lean in from our perspective and help move the industry forward on the clean agenda also. So it's a very important place where we want to compete with the best in the world and emerge as the leading choice for citizens, for drivers, and also for the governments in their agenda for transport in the cities.
Yeah. We are very excited and hope that this pandemic gets over. We go to London and we use Ola over there. Yes. Yeah. Okay. So now shall we continue? I don't know, because it's such an international conference, so we have to figure out that we don't overdo the time. But, last, I've been hearing about and we shouldn't be, I don't know if I should be talking, but we've been hearing about the so-called competition that you have, and they are having very difficult time in India, and they have been shutting in some of the cities and places. How do you see the future? How are you looking at it? It is tough, right, for some of the other players and everyone. So,
from a competitive standpoint, Shraddha, I think the competitive, the fact that there is competition and there will always be competition is just a fact of life, right? And it's good for consumers to have multiple services, and it's good for us also because we also remain on our toes and keep innovating. And in the end, it's about innovating faster for the future of what the customer wants and following the technologies of the future. And but I do believe that the industry is evolving very fast, and competition as we define it and business models as we define it from the last 5 years are going to change in the next 5 years. So we definitely want to play the game for the next 5 years. And we believe and we will definitely back ourselves to succeed, not just in India, but around the world on that.
Of course, we know that, and we are rooting for you. I'm sure every Indian, every youngster in this country is rooting, because through you, we also feel very proud. We feel proud of Ola and what you've built. Yeah.
Thank you, Shraddha.
And now, Bhavish.
Manoj Ladwa, and I have the privilege of being the founder and CEO of India Inc. At India Inc., we pride ourselves in producing incisive content, engaging global leaders, and hosting impactful conversations. At India Inc., we believe in winning partnerships by sharing amazing ideas and exploring great opportunities. We believe in the power of shared values and shared ambitions for a better tomorrow. So welcome to India Global Week, where India meets the world and the world meets India. Enjoy the discussions and let's all be the revival.
And welcome from me as well. My name is Edie Lash, and welcome if you haven't been with us here before. Welcome to day 2 of India Global Week. What an incredible response we've seen to so many of our sessions here today. From Priti Patel and Matt Hancock here in the United Kingdom, Prime Minister Modi yesterday speaking to us about the excellent work of India Inc. in bringing India's opportunities to a global audience. And that global audience is exactly what we have. Over 10,000 registered people have come through to watch the sessions, and we're seeing people coming through from 69 different countries and growing. So if you would like to share what you're listening to or seeing on these sessions, please do use our hashtag #BeTheRevival and do tag us, India Inc. So today, I am now delighted to introduce a world premiere performance curated especially for India Global Week by Madhu Nataraj and her colleagues on the theme of Resilient India, where tradition meets modernity. She is, of course, the director of Natya STEM Dance Company, and STEM stands for Space, Time, Energy, and Movement. She's a choreographer, an arts entrepreneur, and an educator, and she cares very deeply about not just dance, but inclusivity, education, healing, teaching, social issues, empowerment, and sustainable development. So from me and from all of us at India Global Week, please do take this moment to enjoy this special moment.
Namaskar. On behalf of Manoj Ladwa and Team India Inc. and the Natya STEM Dance Company Bangalore, I extend to you a hearty welcome to this section of India Global Week 2020. Dance is a reflection of life. In fact, in India, we believe that the very process of creation, of sustenance, and of destruction is seen as the cosmic cycle of life, personified in Indian iconography and symbology in the form of Shiva, the cosmic dancer. And the presiding deity of the stage, Ganesha, the elephant-headed god, who stands at the threshold of change. Today, we're all facing disruptive times, a very creative time, challenging times, and we invite to our viewers auspiciousness as we stand on this threshold of change. With that intent of inviting positivity, the first piece on tonight's repertoire is Tandav. This piece is inspired by the sculptural splendor, the architectural beauty, and iconography of the temples of South and Central India. What is unique about this piece is that every movement that you see, the movement stock, is taken from a 2,000-year-old book on dramaturgy called the Natya Shastra. You will see, ladies and gentlemen, that although the movement stock comes to us from centuries ago, it is still very contemporary and its presentation in the optic it offers. And that is testimony to the timelessness of Indic thought, of Indian philosophy, and Indian dance. This piece is choreographed by legendary guru and choreographer Dr. Maya Rao, performed by the Natya and STEM Dance Company. Bharat is Atmanirbhar, self-reliant. It is hugely resilient, constantly evolving, and very creative. This diversity of thought is reflected in the Indian dance ethos. I'll tell you why. India has about 8 classical dance forms, over 5 known martial art forms, and a few hundred folk and ritualistic forms. As I talk to you, we're still finding out more that we probably don't know about now. So how does one define the Indian dance heritage in a day? We are going to make this possible by showcasing one of each genre. The classical forms of Kathak and Bharatanatyam, the operatic tradition of Yakshagana, folk forms from across Western and Northern India, martial art forms from Eastern India, all merging into an identity called Bharat. The next piece, ladies and gentlemen, that we have for you is Unity in Diversity.
Hey,
Namaskar, everyone. It's such a great pleasure. It's an honor to talk to a friend who's also such an eminent artist, Madhu Natraj. Thank you, Madhu, for this lovely conversation that we're going to have on art and what it means to all of us today.
Namaskar, and thank you so much, Vikram. It's both an honor and a complete delight always to be in conversation with you.
Thank you. And so in the context of the new presentation that you and company is doing, I thought we'll talk a little about things which we've always spoken, in over coffee, over conversations. As an artist, are you always very conscious of the fact that you are the inheritor of a legacy, that's come down not just a few years or centuries, but over 2,000, 3,000 years. The Bharata's Natya Shastra, which was composed so many centuries ago, is something that you as an artist is embodying almost on a daily basis. So what does that make you feel, and what kind of responsibility does that put on you as an artist?
Gosh, I think now it sounds huge after you put it that way. But yes, I think every single day as artists, at least I am very conscious of the fact that I am setting a precedent, and that I have to have the humility to know that the art is bigger than me. It always will be, always larger, more encompassing, and that we are all receptacles. Yes, some people call us custodians of culture, but I think we're basically storytellers who are taking forward this tradition and adding to it our angle of the socio-political scenario around us, what is happening as artists. Dance has, as you know, always evolved, Vikram, and even if you look at the Natya Shastra, even Bharat Muni has the humility to say, thus far I have written, but dancers will take this forward to 4 different parts of India and make it their own.
Wow.
Of course, I'm not saying it verbatim, but so that of course is there, and as you know, there's a double legacy here also with Maya ji.
Yes. That is what I was going to ask next about are you acutely conscious of the fact that you've been so fortunate to be both the daughter and the disciple of probably one of India's greatest Kathak maestros, Dr. Maya Rao, who's had a legacy of her own from Shambhu Maharaj ji, and a whole legacy there of Kathak in its most authentic and original form. So how much of that does that weigh on your slender shoulders?
Yeah, that also weighs heavy. But fortunately, I had my guru and my mother was a very, very open-minded person. So even if an 18-year-old walked into her class, she said, "Don't have blinkers on. Have the same kind of respect you have for tradition, for innovation as well." And I think just going back a little bit to the point we were making the last question that you asked me, that tradition can't be pickled, right? It has to evolve. And I think when purists talk about, this is how this was done by so-and-so dancer or Maya ji, etc., and look at what Madhu is doing. So the ready repartee would always be from my own guru that you have to learn dance and then make it your own. Even as an artist, when she taught me, she would teach me a movement, and then she says, "Now make it your own." And also she would customize it for each of us. For example, I have a taller personality, so there's a shorter dancer. She would say, "Haath idhar rakho ya idhar rakho," depending on the angularity you need, the anshubhi you need. And when I took to also contemporary dance, as you know, I have a dual identity as a Kathak and contemporary dancer. She was really, really happy, that I took to it, and she loved the contemporary work we did. And also knew that she had a ready reckoner in me. Each time she said she wants to publish a book or do something, we'd all team up, all of our students, and make it happen. So it does weigh heavy, Vikram, and I think we all have to prove ourselves doubly stronger. But I would like to put this on record, and anybody can come up and challenge me on this. In my whole lifetime, my mother and my guru never wrote a single letter to anybody asking them to take me into a performance or to give me a chance, an opportunity.
Wow.
You know, so I was probably her 400th student, and there were 500 after me, maybe. You know,
Wow.
I mean, just to give you an idea. So, but what I did get is that I learned so much through osmosis. So I really felt I was, you know, part of the Guru Shishya Parampara in the real sense, because from the time you got up till you slept and more, you observe your Guru. You know, you look at how she deals with the situation, how she walks, how she conducts herself. And for me, dance is a womb memory, you know. So I think I feel hugely blessed that I was born to a woman like her and that she was my guru. I feel even if I wasn't born to her, I would have found her as my guru.
I'm sure. And someone like Mayaji, with whom I've been fortunate to have so many lovely conversations with you and her over dinner several times. We've always spoken about this whole aspect that all our art forms, dance in particular, while they may have predated to several centuries back, there is that element of contemporariness. There's that element of timelessness in it. They're as relevant as the artist would want to make it relevant to contemporary issues. So what are your thoughts about our art forms not being frozen in time, like a monument in some archaeological site, but there's an element of timelessness despite it referencing historical themes or Puranic themes and so on, which people may think is not relevant today. So what do you have to say about that, Madhu?
That's such a great question, Vikram, because there are so many different ideas and concepts that come into play here. And just take it one step at a time. Today, in fact, we performed a piece, the company performed a piece called Tanda, which takes all its movement stock from the Natya Shastra, and which is 2,000 years old. And you look at it, it looks as contemporary as a piece that could have been created today, And also, in our Institute of Choreography, like Mayaji said, that you do your Puranic work and then you do historical themes, etc. You also do your Sanskrit theme, based on the Natya Shastra, the precepts of the Natya Shastra. But then finally, you have to choose a contemporary concept, something that bothers you as an artist of today. It could be dowry a few years ago. It could be, a communal harmony. It could be the way a certain sector of society is treated. So, she was very particular that you react and respond as an artist to what is happening around you, because that's what artists did in the past too. And you are
conscience keepers of society.
Conscience keepers of society. You're so right, because when you look at your books, and that's why I think Ma was so fond of you, not just because you're so adorable and such a brilliant mind, and she just loved creative individuals around her, and your book is what got us together. And I think
Gohar Jan.
Gohar Jan. My name is Gohar Jan, and I think Gohar personifies what we're talking about, that she stayed relevant. A woman who spoke so many languages and
adapted to new technology.
And with technology, so she could be as comfortable with technology and with the Europeans as she was with her Maharajas and Gurus, etc. And of course, the balance, the work-life balance that one keeps talking about as artists, for us, I think that line has eroded long ago. And also, I so wish, Vikram, that Ma was here to read your Savarkar book, which is such a delight. Thank you for bringing that out to the world.
Thank you, Madhu. Thank you. And I still remember, I think that that was the initial bond where we spoke so much about also Mayaji's work with the Devdasis of Mysore, where she had gone and interviewed them. And that was such a revelation, the kind of conversations we had. And speaking about artists, I think adapting to technology, look at how sitting in the same city, we are having to do this over Zoom, given the conditions that we are in today as a society. The other thing that I want to probably touch upon is the fact that I think there was someone in the gramophone company, the report you spoke about Gohar Jan, when they came to record her. There were these reports that people would put in where they said India is such a fascinating country where almost every few kilometers, the changes, the food styles changes. I mean, and naturally the art forms also change. So, in what is a country which is a conglomerate of so many different cultures, traditions, languages, dialects, people, customs, natures, and all of that, we are still holding on together as a nation, culturally. I mean, people could always argue we became a nation state or so on politically after the British, but culturally, right from the Vishnu Puran, we've always been deemed as one, geographic, sacred geography, a cultural entity. So, as an artist who's, of course, your training might be in one particular art form because one cannot train in all art forms, but then this whole fact that there are multiplicities of art forms, particularly in dance, 8 classical dance forms, so many folk art forms, martial arts, all of that. So how does one view this diversity? Is it a handicap for India, or is it this unity in diversity that we keep harping all the time, right from our school essays that we wrote? Is that an advantage for India?
I think it is an advantage for India because I feel that, when we accept diversity, when we accept distinction, then we are open to change. And I think this COVIDian times, the pandemic has taught us one thing, it is that we can't predict anything. And also that, to be fearless about the future. Take one day at a time. This is what all our philosophies, especially our Hindu, Buddhist philosophies, talk about, being in the present moment. And I think when we are used to so much diversity, we are open to transformation, to change. I mean, we should be, of course. That is the other side of the spectrum, the other side of the mirror, as we all know. But I think that's what makes us special, and that's what makes us, you're right, so difficult to explain to someone when you say, I'm Indian, what does that mean? As you said, 20 kilometers from Bangalore, the cuisine starts to change, the weave starts to change, the way a sari is worn has changed, dance forms. So, I mean, over 500-600 dance forms in India alone. And somebody was talking the other day about, the whole of the Western world is so clued into ballet. Why doesn't it happen in India? I said, the whole of the Western world has one classical form called ballet. In India alone, we have 8 classical forms. Each one as evolved and developed and refined as ballet is. So, I think we hold a huge legacy on our shoulders, Vikram, I think, which is great. But I wish people were a little more open to innovation in our country now in the 21st century.
I think that's such a wonderful, thought that you brought about the diversity and how it can actually be an asset for India if we would want to look at it that way. And as somebody, who's fused the ancient arts, the traditional art form of Kathak with contemporary dance, and your body of work on that being so rich, I think it's work like this which is most relevant today in today's world, where people are grappling to find answers for contemporary issues using our traditional knowledge, traditional thought processes. So thank you so much, Madhu, for this very, very interesting and enlightening conversation. And I think as artists continue to readapt and reinvent ourselves, we'll find new avenues, not only to showcase what we have for the rest of the world, but also catch up like this, perhaps in the online space much more than in person, even though we live in the same city.
Thank you so much, Vikram. It is an honor talking to you. I wish you could be with us at our studio right now, having a filter coffee and having this conversation. But thank God for technology at this moment as we talk about tradition, and truly a meeting and coexistence of the two. Thank you so much.
Thank you. Thank you, Madhu.
Namaskar.
The acknowledgement of the polarities, the opposites, is another interesting philosophy in Indian dance. Shiva, seen as the masculine presence, and the feminine power, Shakti. If he is the mountain, she is the river. If he is the universal spirit, she is flesh and blood, Prakriti. yin and yang, positive, negative, lasya, tandava, call it what you may, but in the merging of the two is the essence of Indian dance. The next piece that you watch personifies this philosophy. We begin with a very interesting interactive multimedia piece where art and technology meet. The dancers interact with imagery and create a Panchabhuta Mandala, the 5 elements: earth, water, fire, air, and the most metaphysical of them all, space or ether. After this, the dancers go into a piece called Ushas, which is an obeisance to both the goddess of dawn, Ushas, and to Surya, the sun god. This piece represents the attributes, the qualities of India seen in these entities: strength, self-reliance, and energy. This piece is unique because it brings together various movement disciplines from India. The martial art forms of Kalaripayattu from Kerala, Chau from Odisha, from Jharkhand and West Bengal, and Thangtha from Manipur, merging with motifs of Hatha Yoga and contemporary Indian dance. Ladies and gentlemen, we have for you Mandala, the cosmic floor plan of the universe, and Ushas. We journeyed from the Natya Shastra to various parts of India, looking at the various movement disciplines. Also, these forms resonate the socio-cultural evolution of each of these regions through history. So, dancers also are receptacles, chroniclers of time and space. Dance cannot exist in isolation, is our belief. India has inspired many, but has also been open to being inspired. This cross-illumination between various fields is very, very important for any kind of growth of an art form or of a philosophy of a nation. This next piece that we bring to you is the perfect echo and link to this idea. Kathak is a dance form that evolved in the temple precincts of Uttar Pradesh and Rajasthan. Over time, these traveling bards took stories of the Indian gods and goddesses with them. We have had many invasions, and with the influx of iconoclastic rulers, these dancers went underground and their ghungroos were silenced. But they reinvented themselves and re-emerged from the temple to the courts. They resurfaced as court dancers in the courts of Rajasthan and Uttar Pradesh. With benign rulers such as Akbar the Great, Jahangir, and then Wajid Ali Shah, this dance form took on a beautiful Sufi Persian element into its stride. Today, Kathak is a beautiful amalgam of both the Hindu and Islamic cultures and of many influences. In fact, the piece that you're going to see next, Sankalan, which means an amalgam, a union, brings together Kathak and a dance form which is inspired by it and practiced in Europe, flamenco. They say that gypsies traveling through Rajasthan, Afghanistan, Turkey, Romania, Spain took this form with them, and being artists, there was an exchange of ideas, and these two forms mirror each other till today. It is our belief of our company that dance, philosophy, knowledge, and technology cannot be bound by barriers that are geographical, political, or racial. Ladies and gentlemen, Sankalan also brings to you interesting conversations or jugalbandis between the dancers. We have for you now Sankalan.
Madhu, firstly, a huge thank you. That was such a heart-rending and beautiful performance. It was scintillating, it was touching, it was beautiful. It was poetry in motion, in other words. I think the way you and your team have gone about the journey of depicting India, Atmanirbhar India, or Atmanirbhar Bharat, from tradition to modernity, was just something that touched the soul. It was truly poetic, movement in motion, and I absolutely loved it. So on behalf of everyone who's watching, I know that that would have given us some remedy and relief in these really interesting times, and that was just such a beautiful and passionate and compassionate performance that really wanted to thank you for that amazing effort that your team and everyone has done coming together in a time like COVID as well. So deeply, deeply appreciate it.
Thank you so much. Thank you, Umang. Very, very kind words, and coming from you means a lot more. And on behalf of the company, we thank you.
No, thanks a lot. I think the pleasure was all ours of just watching that beautiful performance. Madhu, I'd like to ask you, at the end, society goes through its highs, lows, its transformation over the ages. But at the end of it all, what's left in society, or you can judge the quality of a society by the quality of the arts. What does today stand for in terms of, what does art really stand for in today's transformative journey for us as a society, as we are going through some really unprecedented times?
I think what the arts teach us to do, Umang, and that is something that is never really acknowledged in a society unless there is a crisis or otherwise, is that it teaches you to be fearless, it teaches you to be spontaneous, and it teaches you to be in the present moment. Because when you are immersed in an art form, whether it's my sadhana with dance, or it might be a musician, they might be an artist, or they might be a writer, the very fact that whatever happens around you, you dip into your oasis of riyaz or practice regardless, is like meditation. And when you're practicing your art, you're in the present moment. And it teaches us to walk into our studios or into our places of creation. The moment you leave your chappals behind, you have to leave all problems, egos, etc. behind. Is what we train, but many iterations, it just comes into our DNA in a sense. And also the fact that to be fearless, that change is a constant. And I think these COVIDian times have taught us and have also splintered this psychological barrier against change for most people, isn't it? We've all seen that, and we've become more resilient, and everybody turned to the arts, whether it was to read a book, watch concerts. Artists were so generous at this time, sharing their work worldwide, or it was to watch movies or whatever. I mean, the arts are an immersive oasis. So I think also when you are immerse yourself or engage with the arts, you learn to be more spontaneous. So it's not about constantly following a mob. So you're thinking out of the box. At the same time, you know how to adhere. So I think that's the importance of engaging with the arts. Very less is spoken about it, and it's also, even otherwise, it's a strong undercurrent of our society. And you're so right when you say that when you look at the state of the arts in a society, you can gauge how much they've evolved. And in that sense, India is always been very kind to its artists, and because the patronage is two-way, right? So it's engagement, immersion, but as in today's language, with this stimulus response, there has to be a connection. And I think as Indians, whether it was in ancient times or modern times, we connect to our arts.
Well, that's such a beautiful answer. I think what I was reflecting on when you were talking was three things that stuck with me. One is the arts are an immersive oasis. I'd never thought of that. The second thing that you said is that it really represents fearlessness. And the third thing that you said, as society evolves, it goes through this transformation and this adaptability. And when I'm going to try and make this a little difficult for you now, right? If, as business leaders and people who run companies or are involved with economic decisions, a lot of what you just said is what we are telling our teams, our communities, that here's a time that we need to be fearless. We need to be highly entrepreneurial. We need to transform. We need to adapt. We need to thrive in this adaptation, because only when we can change and constantly adapt ourselves is when we can truly become a company that has been built to last. As an artist, if you had to give advice to the business community on your core learnings, because what you just said really resonated with me, but if you had to give advice to corporations, to CEOs, no pressure there, but if you had to go about that journey of just sharing with us in a time like this, which is highly unprecedented in the last 100 years, what would your guidance to us as a society be? And I'd love for you to share that with a correlation with the arts.
That is a toughie, Umang, but a wonderful question. I love that challenge, and I'll try my best. So I feel that, as Indians, first of all, let's start from a common platform. We're all, whether corporate honchos or artists or people in different industries, we're all a very, very resilient bunch. And I think you and I have had this conversation also, that we firefight every single day like nobody else in the world can, living in India and working. So resilience is something that we've already taken on as a partner for life. And the arts, like if you look at Kathak by itself, I feel if I am a Kathak dancer today, and it's a tradition that has been passed on for thousands of years, I feel I'm a receptacle, of that journey of resilience, because it has faced from lack of patronage to invasions to complete isolation, and re-emerged, reinvented, recreated itself from a temple form to a court form to a to a proscenium form too, as you saw in the piece, the Kathak and flamenco, that it is India, it is Kathak that inspired flamenco, and we still mirror each other. So I'd like to say that behind all this talk about resilience and firefighting, resourcefulness, there is one core attribute that we all have to have and nurture, and that's creativity. I really think creativity is a 21st century life skill, and this time has taught us that it is this attribute that we tap into, then we reinvent, we realign and recreate, regenerate. But to be able to do that, we have to first acknowledge that each of us is very creative. And definitely, I think that is a quality, whether I'm an artist or a person like you, who in my mind is already very, very creative, doesn't acknowledge it, is something we all have to nurture. And also this whole concept of, so when you say creativity, in India, we have this concept of Shakti. And one scholar once gave me a beautiful definition of Shakti, because people say it's energy or, omnipotence, etc. And he said, Shakti is the capable will. I'll leave you with that.
Wow. I mean, I was so blown by that answer, and it reminded me of, I think, a conversation we had years ago, wherein if I asked you what is create, if you weren't creating, what would you rather be doing? And I think you said something to the lines of, creativity is my reason for existence. And if I wasn't creating, I'd rather not be alive, right? And I think I absolutely love that answer, because I never realized how artists are constantly evolving their art form. And the piece that you referenced around the Kathak and the flamenco coming together reminded me of a huge opportunity. We live in a globalized world. And, potentially this is a time where we as India can probably reinvent ourselves, be a whole lot more creative, and use this as an opportunity to reinvent and redefine the world order in so many ways. So how do you look at, Madhu, one last question if I may, how do you look at the confluence between art and technology? Because, there's the left brain and the right brain, there's the art and the science, there's the diversity and the the complete laser focus. They're completely, diametrically opposite concepts. But what you just showed was, I would have never imagined two diametrically opposite dance forms like flamenco and Kathak really driving that influence of globalization. So how does that art and science really, or art and technology, or the left brain and the right brain really come together for you in this journey?
So Umang, I, as you know, have a dual identity as a Kathak and a contemporary dancer, because I live this philosophy of coexisting with tradition and modernity. And I think each of us as Indians does that every single day in our lives. And therefore, I feel that to me, as an artist, it's important that I'm relevant. Not to find a convoluted route to get there, but I really feel organically that I'm an artist who has lived in the 20th and now 21st century. Yes, I have carried so much knowledge that has come down to us from generations, but we have to be relevant and we have to inspire and be inspired constantly. And so if you remember the third piece we saw, Ushas with the mandala formation, where dancers use technology. This was a piece created way back in 2004. This was one of India's first pieces with interactive multimedia technology to offer the idea of the Panchabhutas, the 5 elements coming together. And to me, I really believe that creativity is about having one stream that you're very familiar with, that you are, as you say, you're needed in do sort of in that. It could be business acumen for some, artistry for some, and a second line that you don't know much about at all. So it could be technology. I'm still very technologically challenged, but I have a wonderful team of artists who works to bring this together. When you create a groove and the water flows into both, I think that's a creative moment, And similarly, this whole concept of, since we are celebrating India, let me bring in some Indian philosophy. When we talk about the left and right brain, it is beautifully shown in iconography and philosophy as the Ardhanarishwar. The right side of the body is Shiv, or the side that is more, shall I say, managerial, etc. And the left is Shakti, creativity. So, but of course, the right brain manages the left, and the left side. There itself, there is balance. So whether it's, as you will see in one of the pieces I've spoken about that, whether it's yin, yang, earth, sky, feminine, masculine, the thing is, unless there is balance, we really don't have anything. And I really feel that this confluence that we must have between technology, various fields and arts, I believe there has to be cross-illumination. And you believe it too, otherwise why would you call an artist, a dancer to come and speak at a business conference, right? You believe in cross-illumination. We are like water, Umang, you and I and all of us. You put us in any situation and we are like, put us in a bottle, in a matka, in a tin, we'll find our equilibrium. Left and right.
Wow. There was one thing that you said so early on, and of course, contrasted so beautifully towards the end on the right and the left brain between Shakti and creativity. But you said something around organically we have to be relevant. And we have to keep transforming ourselves to drive that relevance. And I think, when I close my eyes thinking about that, reflecting, it could have been an economist saying it, it could have been a business leader saying it. I would have never bet $1,000 that it would be an artist who would tell me this, because it is so true. And that is who we are as a society deep down. Like you rightly said, the Indian tradition is so rich and has been so kind to the arts. Madhu, I know we could go on for hours, but it has been an absolute pleasure. Not only have I been enriched by watching the performance, but I think the last 10 minutes when I've been speaking to you has enriched me furthermore. Thank you for that gift, and wish you and your team all the very best. Stay safe in these unprecedented times, and God bless.
Thank you so much, Umang. An honor indeed to talk to you. Namaskar.
And with that, we come to an end of this section of the India Global Week 2020. Heartfelt thanks to Manoj Ladwa and team India Inc., Umang Bedi of Daily Hunt, and all the wonderful artists that you saw perform today. Please do check in the credits to look at their names, and we hope to meet you again, virtually or otherwise. Namaskar.
I'm Manoj Ladwa, and I have the privilege of being the founder and CEO of India Inc. At India Inc., we pride ourselves in producing incisive content, engaging global leaders, and hosting impactful conversations. At India Inc., we believe in winning partnerships by sharing amazing ideas and exploring great opportunities. We believe in the power of shared values and shared ambitions for a better tomorrow. So welcome to India Global Week, where India meets the world and the world meets India. Enjoy the discussions and let's all be the revival.
Welcome from me in London. It's day 2 of India Global Week, and welcome to this very special discussion, Conscious Planet, The Way Forward. Kunal Nair in conversation with Sadhguru. Sadhguru is, of course, one of the 50 most influential people in India. He's a mystic, a visionary, a yogi, and an author, and he is deeply involved in many different fields: architecture, design, poetry, painting, sports, even motorcycling. And 3 decades ago, he founded the Isha Foundation, a non-profit organization with human well-being at its core commitment. And we do need a lot of well-being at the moment. These past 100 days, or maybe more, I've definitely lost track, have been spiritually, mentally, and physically tough for many of us. For some of us, including myself, meditation has been useful, yoga has been useful, and Netflix has as well. And if you've spent time in Netflix, you may well have encountered the host for the conversation today. Kunal Nair is best known, and certainly in my family, for his work as Raj on television's #1 comedy, Big Bang Theory. If you haven't seen that, you may have seen him in the Royal Shakespeare in Stratford. And if you haven't seen that, you may have heard his voice in Trolls or Ice Age films. Kunal, you have kept me smiling through COVID-19, and I very much look forward to listening to your conversation with Sadhguru. And I may very well come back at the end to ask some of the audience questions that we've heard. Over to you now, Kunal.
Thank you so much. Hello, everybody. Good to see you. It is a great honor to be here today from Los Angeles to spend this time with you, and of course to spend time with Sadhguru. I thought I would at least let you know how I met Sadhguru. I met Sadhguru in the most spiritual of places, actually on a golf course. And at that time in my life, I had been taking his inner engineering courses. I had begun at least an inner journey, and Sadhguru had really become a torch for me in a very dark time in my life. And I am very lucky in my life now to have, I hope, a good relationship with Sadhguru. Although every time we play golf, all he does is be mean to me. We always end up on the same team. And I remember the last time I was playing golf with Sadhguru, I wasn't playing well. And at one point I stopped and I said, Sadhguru, you're this great Indian mystic, this great guru, say something nice to me. And he said, only if you do something nice will I actually say something nice. So I stood over the ball. I said, I'm going to hit this 300 yards, whack, right into the trees. And the rest of the day, the abuse continued. Okay, so you might think Sadhguru is very nice, but to me, he's always very mean. Anyway, very honored to be here. Let's get going, because I know it says in conversation, but I'm presuming I'm going to let Sadhguru actually do all of the talking today. Today's talk is about moving forward, about being the revival, about a conscious planet. So let's start there. Let's start with a conscious planet. So my question for you, Sadhguru, is let's approach this on 2 levels. Each question at a human sort of personal, can we do at a personal cellular level? And then we'll take that approach and see how this can be used in a universal and worldly approach as well. So the first question for you, Sadhguru, and don't be nervous, these are very difficult questions.
Before you go into the questions, namaskaram to all of you, Manoj, Eddie, Kunal, of course, and everybody else who is there in the conference. My namaskarams to all of you. please, Kunal.
Yes, thank you, Sadhguru. So the first question is, most of us have a understanding of the word conscious or unconscious, and for those of us who don't, we can look at a dictionary and understand what that word means. But from a spiritual point of view, or from your point of view, or from your understanding or your experience, what does it mean to live a conscious life? What does it mean to live an unconscious life, and at a personal level, and how does that translate into a worldview?
Well, well, Kunal, you've introduced me well, so I can go ahead without any breaks on it. Well, to put it simply, you cannot understand what is consciousness. Because understanding always comes from accumulated knowledge about something. Essentially, consciousness means an intelligence within you which is not shackled by your memory, an intelligence which is completely unsullied by your memory. There is an dimension of intelligence within you which is untouched by memory. Everything else about you is memory, whether it is, evolutionary memory, genetic memory, karmic memory, conscious, unconscious, subconscious memories, various types of memories. In yoga, we see 8 different dimensions of memory. Everything that you are, the shape of your nose, the color of your skin, the way you sit, the way you stand, the way you speak, everything that you call as myself is an amalgamation of a very complex dimensions of memory. But there is a dimension of intelligence within you which is not ruled by your memory. Why is this dimension so important? Because memory means survival. Memory means a boundary. What is within my memory is familiar to me. What is outside of my boundary is strange, or well, you're in California, it's weird, all right? Anything that's not in your anything that's not in your memory is bound to be weird. So, what is in my memory is my friend, what is not in my memory, who is not in my memory is a stranger. This is the basis of your experience. So, there is a dimension of intelligence within you which is unsullied by memory. Only when you touch this dimension do you know what it means by saying limitless or boundless in terms of experience, because every other experience is encapsulated within the shackles of your memory. As useful as it is, the memory, it is also a prison. It is our survival, it is also a self-imprisonment. Survival of the self and self-imprisonment, both these things are done. Memory is a wall that you have created, within which there is a whole world of your own. But memory means in some way physiological and psychological process. Your physiological process may be run by the evolutionary memory and genetic memories. Your psychological process is run by a variety of other dimensions of memory. But essentially, memory means your physiology and your psychology. The biggest mistake that we have done right now in the world, especially the Western societies, the way they're looking at it is, we have misunderstood or mixed up rather psychological realities and existential realities. So this is why always we are trying to understand something. The way we are talking about India right now, the way the Indian culture or the Bharat has looked at is, it is always about realization, not about understanding. So consciousness can be realized but never understood.
Thank you for that. On along those lines, if we are shaped by our memory, if our consciousness is shaped by our memory, what can
No,
we
no, I would
do
like
to
to correct the
move?
question. Our
Yes.
consciousness is not shaped by memory. Our conscience may be shaped by memory, because conscience is a social phenomenon.
If our memory is our prison, what can we do to get out of jail then?
Before we call it a prison, we must also understand, today the way you are, your memory is also your possibility. Everything that you're doing is from your memory. A whole lot of your memory may not be conscious memory, but see, the English word conscious is used in many different ways, so there could be confusions about that. We are talking in terms of physiologically being conscious or unconscious, psychologically being conscious or unconscious. Consciousness, we'll keep the word consciousness little away for the sake of understanding. Being conscious and conscious is a different aspect. So, everything that you are, from the shape of your body, from the color of your skin, the way you understand life, the way you perceive life, everything is ruled by your memory. So, it is also your possibility. At the same time, it is a limitation. You will realize the limitation of your memory only when a longing to grow beyond these limitations arises within you. See, every human being has a longing to be something more than what they are right now. But that something more is a very incremental piece. So this is why we need to fast forward our life and see right now. Little desires that you have, when you were a 8-year-old boy, maybe your greatest desire was a bicycle or something like that. Then it went on expanding, expanding. So this desiring process is a longing to expand within a human being. This longing to expand, we are going in an incremental way, by installments. Right now, sit here, everything that you have desire for, let's say it's right now come true, what's next? You will desire something else, something else, something else. Just do all this right now in the next 5 minutes. Everything else that you could possibly desire till the end of your life. If all of it is done right now, what is next? Then you will see you still want to expand in an unknowing way. You still want to be something more than who you are. When this longing becomes a conscious process, then naturally you're seeking to break the limitations of what you know. This is why in yoga, the yogic culture always saw that knowledge is a limitation. We never identify with our knowledge. We always identified with our ignorance. Because what I know, it doesn't matter how much I know, what I know is a minuscule in this existence. If you compare what you know to the cosmic space, it is an absolute minuscule. But what you do not know, your ignorance is boundless. So we always identify with our ignorance. The entire culture has been built upon it. This is something that has been seriously misunderstood by the rest of the world. Why India has been the way it's been, though there is an immense amount of knowledge right from ancient times, why is it they refuse to exploit knowledge? Because they saw that exploiting knowledge more and more, just using it to the extent that it is necessary for your life is different, but basing your life on the knowledge that you possess will ultimately trap you in a way that you cannot extricate yourself. That you start building, it's like a spider's web, you start building the web of your knowledge and you get trapped in it. Right now, see, whole lot of people are trapped on the internet, but we are making use of it, it's good.
So, what role does knowledge play? What role does intellect play in moving forward, in shaping a planet that we want to inhabit for a long time? What role can those things that all of us use on a daily basis that we know, how can we use those things to our advantage and not be entrapped by them?
I don't know whether you use this consciously or not, but you use two words in this question which are very significant: intellect and knowledge. Because your intellect is absolutely useless if you do not have a bank of memory, which is knowledge. If you do not have any memory, if I wipe out all your memory, you will find your intellect is useless. So today we have this experience, like today you buy a new computer, maybe the best in the world, but it still doesn't have any memory in it. Well, it's just useless. So this is the nature of your intellect. Without memory, it cannot function. So right now, we are misunderstanding intellect as a means to explore new dimensions. No, you are only recycling old dimensions, endlessly recycling old dimensions, coming up with permutations and combinations and believing that you are entering new dimensions. Well, we could take examples and go into it, but it'll take time. But anyway, everything that is already there in your experience, in some way, you are trying to explore and think you have done something fantastic. I am not saying it's not fantastic, it has brought many, many possibilities into our lives. Knowledge is useful as a survival tool. Intellect is useful as a survival tool. When we say survival, maybe if we were, whatever number of years ago, we were cavemen, you are beginning to look like one, I've always been one,
Yes.
all right?
I learned from the best. I learned from the best.
No, no, the beard grows naturally on a man, but somehow it's become weird these days. Because someday it may so happen nose will be weird and everybody will remove their nose because, today the virus is there. Mask is not weird anymore, mask is normal,
Yeah.
all right? It's a new
Yeah.
normal. So
Depends
what is
where
our…
you are.
Today, wherever you are, mask is normal. You don't have to be a bank robber for that. So, this intellect cannot function without knowledge. That means what can it do? It can recycle the data that you already have in various permutations and combinations, but it cannot come up with anything new because its root is in its knowledge. So, what is the use of knowledge? Knowledge could enhance our physiological and psychological existence. But how much will you enhance it, I'm asking? Physiologically, if your food is taken care of, your health is taken care of, its basic needs are taken care of the body, it's a done thing. There is nothing more you can do. But today you see a weird world trying to do all kinds of things to stretch physical experiences. Why there is such a overflow of alcohol, drugs, sexuality is simply because people are trying to stretch the physiological boundary. You must understand the essence of physicality in the world is a defined boundary. Without a defined boundary, there is no physical nature. Now you're trying to breach, in your longing to expand, you're trying to breach the physical boundaries of your existence. Well, it's a wrong way to do. This is why they're telling me 30% of the people are obese on the planet, because they're trying to stretch their physical boundaries, either absolutely physically or in terms of experiences. A whole world is moving in this direction. Somehow, they want to stretch their experiential dimension. Right now, because their whole experience is limited to physiological and psychological experiences, they're trying to stretch that. You think you're stretching it, all you're doing is memory. You cannot do anything else with these two dimensions. So, when you realize the limits of your physiological and psychological existence, that is when you will seek something beyond, which right now the English word is not really competent to describe, but the word consciousness means a dimension beyond this. In the yogic culture, we call this chitta. An intelligence beyond memory is called chitta.
So how do we, as, let me put it this way, is it more important to take care of the planet consciously, or is it more important first to take care of the inner journey consciously, or are they inseparable?
See, when you talk about taking care, for taking care you need knowledge, because taking care is survival. Whether you take care of this body, take care of this mental well-being, take care of your family or your society or global societies or all life on this planet, this is from knowledge. So taking care essentially means survival, isn't it? So don't link survival to consciousness. Being conscious that our life is, enmeshed with every other life on this planet is knowledge. It is not consciousness. But this knowledge could have come out of consciousness, but unfortunately, this knowledge also we have acquired incrementally, you know, very piece by piece. Through scientific knowledge, we pieced all this together and now we're talking about environmental science. But this is something that you could realize from your limitless sense of experience, because your experience transcended the limitations of your own genetic and evolutionary memory, and you know the way the world is made. In the sense, in yoga, we are always saying anda pindanda. What this means is, the way an atom is made, that's the way the entire cosmos is made. So individual life, if you realize the nature of this life, in a certain way, you have realized the nature of the whole cosmos. This is the basis of yogic science, that if you know the very essential nature of what this is, you know in reflection what everything else is. So, how do we have to take care of this planet consciously? Definitely, we have to take care of this body consciously, we have to take care of the planet also consciously, because your body is just a piece of this planet. If the planet is not healthy, your body is not going to be healthy, is a simple realization, but we have gone around 200 years of science to come to this, and still we are not able to convince everybody on the planet, all right? Because there is no such inner experience, there is no realization of what am I made of, so it is just going on. And to convince somebody that the health of the planet is directly related to your own health and your life, just see how much it is taking. This is simply because you're trying to bring consciousness with bits and pieces of knowledge.
Speaking about unhealthiness, since we're on the topic, given COVID and given the times of disease, let's say this time is a time where we are obviously afraid of the disease, we are afraid of contracting the virus, the planet may be in one way healing, but humans in one way are suffering. So the dichotomy between those two, can you speak about that and speak about the times and health during these times, both mental and physical?
So, as you said, the dichotomy between the two, which means essentially we've gone away from the life process, how life happens upon this planet. We've moved away. As I said earlier, we've mixed up our psychological and social existence with the existential realities of life. Existentially, our life is not separate from the life even of the virus, I'm saying, because there are more microorganisms in this body than the number of human cells that we have, actually, many more. So, our life is not different from the life of the virus. But right now, the virus lives so vigorously that in our body, it is becoming virulent in some sense. So, having said that, why have we moved away? Simply because we have taken our individual experience rather too seriously. We must understand that as you sit here, you're breathing. That means you cannot exist without the atmosphere. To sit here of this size and shape, you have eaten plenty in your life, because it's just the soil which has become food, and food which is sitting here as you and me. And the food that you eat, the water that you drink, the planet that you walk upon, the air that you breathe are not separate, it's all one existence. But it is the magnanimity of creation that for a tiny speck of a life like us, when I say a tiny speck, people think, what is he saying? Well, in the cosmic experience, if you look at the cosmic space, this solar system itself is a tiny, tiny speck. In that tiny speck of a solar system, planet Earth is a microspeck. In that microspeck, Los Angeles is a super microspeck. In that, you are a big man. This is a serious problem. This is a problem human being it's okay. You said it's okay, you're used to abuse, you told me so.
I'm used to your meanness. It's okay. I'm used to it. I can
So
handle it.
this is the essential human problem, that they have taken their individual nature rather too seriously. We must understand, for a speck of a life that we are given an individual experience, is not that something we earned. It is the magnanimity of creation that it's been given to us. But people are taking their individuality so strongly. Now they're thinking, why this virus, why this bacteria? Arey, you and me exist because of virus and bacteria. Why is it going wrong in my body? That's what we need to see. Why is it? It is not my friend. Why is it working against me? Why is it that I've brought something which is not my friend into my system? This is something we need to look at it, but right now we are seeing how to kill all the virus on the planet. If we kill all the microbes on the planet, that's the end of life on this planet.
I want to go back to something you said that is so beautiful, which is we are so we take our individuality very seriously, and but that's also because that's all we know. If you sit and you say to me, you can sit here and you can be the cosmos, I, through my experience of meditation and silence, may be able to experience that. But I feel people, it's very intimidating, I think almost scary for people to give up that individuality, because maybe for years and years and generations, that's all we've known as our individuality. I think that it feels intimidating for someone to realize that they are actually part of the cosmos, or that all is one, or that they are one with all. I think that it's a beautiful it's a beautiful experience, but I think what scares people is that either they'll say it's just a concept, it doesn't make sense, or if I am to believe that, then how am I, what happens to me? And I think this is, I would love to hear for someone who is almost slightly scared to jump into the ocean of all of this, what you would say to someone like that. Where does that initial fear come from?
Well, uh, see, we kind of going back to this. I clearly said, you cannot approach limitless consciousness with limited knowledge. Again, you're attempting that. Don't do that.
Yeah.
There is no need for every human being to think, how do I become cosmos and all this nonsense? It's not necessary. First of all, you said, if I do believe that, you should not believe a damn thing. You understand? You do not believe anything or disbelieve anything. That is when you have identified with your ignorance. Identifying with your ignorance means you clearly understand what you know is a minuscule, what you do not know is a boundless possibility. So if you have identified with what you do not know, in a constant mode of seeking, if you are in a constant mode of seeking, or the basic qualification to be a seeker is you have life not. Unfortunately, without knowing anything, you will have confidence. So people have chosen confidence against clarity in their life. Biggest mistake. Everybody wants to believe something because, I want you to just imagine, let's say right now you're fitting the role, in case you get a role like this on the television that you have to play a caveman. You're you're kind of growing there. You need to grow a little more, but you're
Yeah.
getting there, all right? So suppose you are a caveman. Without protection, you're just living outside. Most people don't know what this means. Only those who have been in the wild, who camped outside, but today camping is also like a luxury hotel. Okay, if you just been there without any equipment in the jungles, which I have spent weeks and weeks at one time, well, if it just rains, monsoon rain, people think all you need is an umbrella and run to your home. But you just stay in a tropical forest when the monsoon rain is pouring, with lightning, thunder, everything going, and all creatures trying to find their own little shelter. The little shelter that you have found belongs to somebody else, and that guy will take it aggressively, all right? The whole experience of this planet and the way life is happening on this planet, if you just feel it, you will know what I'm saying. If you were up in ages ago without any protection, without any equipment, without even a watch, because that's how I was when I was in the jungles, I didn't even know what time it is, and I'm not even able to look at the stars or the moon or anything because it's cloudy and it's pouring rain. You don't know how long you've been soaked. You don't know when daylight will come. You slowly start having doubts, will it come at all? Is there a guarantee? Because there's no guarantee about that either. So essentially, if you are there, then you you felt so threatened, your existence. You felt how small you are and how your existence is threatened every moment. People are thinking their existence is threatened only because of this virus. No, your existence is threatened every moment, all right? If you are conscious of it, naturally you would want to find something that builds confidence in you. So you decided to believe in something. Initially, they thought sun came up in the morning after being soaked in the rain for 12 hours. Then you said sun must be God. Like this, it grew. And then we made more human forms of gods and whatever. So you started believing in God, which gave you confidence, which did not give you clarity. Confidence without clarity is a disastrous process. And this disastrous process we have taken on for the last 2000, that continuously we've been building. This disaster has cost how many lives you can calculate in the last 2000 years? It's taken too many lives. This is the significance of India, that this was not a culture of belief, this was a culture of seekers. This is why you found them, though they were hugely empowered, massive kingdoms, enormous wealth, but they were always like this, bowing down to everything because there was no confidence. No confidence, we did not see it as a negative process. No confidence we saw as a possibility that you will naturally work towards clarity. The more clarity that arises in you, then you won't need confidence. See, right now you're walking during daytime, where you can see everything clearly. You don't need confidence to walk. But suddenly, let's say it's pitch dark and a new terrain. Well, now you need confidence because there is no clarity. So you're using confidence as an alternative for clarity. This is a disaster because when you have no clarity, one most important thing is at least you must have hesitation. Right now, for example, you mentioned the virus right now. See, we've been driving our economic engine in a certain way. Engine has been roaring. Every human being, every one of us, without exception, have been pushing the throttle as much as we can. But do you know who has the steering wheel? When the engine roars, the most important thing is somebody has a steady hand on the steering wheel. This is very important when the engine roars. Engine has been roaring. Do you know who is holding the steering wheel? Is anybody at all has a hand on the steering wheel? So you've been driving fast, but it is like, these people who are on… because you're from Los Angeles, I'm telling you, it is well before your time. In '60s and '70s, people took LSDs and jumped off the tall buildings thinking they're going to fly, and they did fly for some time. That's the whole thing.
Yeah. I don't know why you're looking at me. I don't take LSD. You're looking at me like that.
I didn't say anything.
Um, no. My parents are watching, please. Um, I wanted to, part of this whole thing is also India Global Week, and you touched upon how Indians are seekers, and that has been a big part of our culture. But what is it that India has done for the world, and how do you see us? What role do you see us playing moving forward in the global spectrum of everything? How do we move forward? How has India helped the world move forward?
So what is India's contribution to the world? If that is a thing, there are 1,000 things to say, but because both of us are on right now in United States, let me count quote somebody, because I'm not used to quoting anybody usually, I'm not good at those things. But let me quote Will Durant, an American writer who wrote about the story of human civilization or something like this. India was the motherland of our race, and Sanskrit, the mother of Europe's languages. India was the mother of our philosophy, of much of our mathematics, of the ideals embodied in Christianity, of self-governance and democracy. In many ways, Mother India is the mother of us all. I think he encapsulates almost everything that I would have liked to say, because it will go into thousands of things that have been contributed and which has been misrepresented around the world. I think I know there are a whole lot of people who will immediately pounce on me for this, But I think a more unprejudiced look at world's history is very needed. Then you will see a whole lot of threads will go back to India. When I say thread, we were the first ones to weave the thread also, the cotton and silk thread, right? And the sutras, the Yoga Sutras, Karma Sutras, Shiva Sutras, Brahma Sutras, and even Kama Sutra, all right?
Yeah. We talk about be the revival. That is a big theme for this week. Are we in a revival? Is a revival of utmost importance? Are we at any point of time always in a revival, or is this a certain point of time where that is absolutely necessary or already a train that is in motion?
See, what do you try to revive? You try to revive that which is dead, right? How do you revive the living, I'm asking? So instead of talking about revival, let me put it this way. See, the greatest contribution, in my opinion, Will Durant maybe did not cover this in some sense. In my way of looking at life, which is not intellectual, you can see I'm not intellectual. My way of looking at life, the most significant dimension that came from India is many thousands of years ago, Adiyogi said that if you are willing to strive, you can evolve into whatever possibility that is beyond the natural limitations of life. What you think are laws of nature which are controlling you can go beyond that if you strive. That is essentially he is saying, you're not some kind of an absolute or some kind of a making of God, that God made you perfect and you're there. He is talking about you can evolve, but it takes striving. Like we know today there's an evolutionary theory which is about 150 years old, that came from Charles Darwin. But many thousand years ago, over 12, 15,000 years ago, Adiyogi spoke about evolutionary process on the planet in a different context. And then he said, as a human being, you can evolve, but you can only evolve consciously. Because unconscious evolution of bringing you to this point of evolution is over. Now from here on, your evolution can only be conscious. But now, if you want to evolve consciously, one important thing, whatever you're calling as yoga, for example, because the entire Indian culture is fundamentally rooted in the yogic culture. When we say yogic culture, let us not think of just twisting and turning as it's happening in the world right now. When we say yoga, we're talking about union. When we say union, in your experience, your sense of your individual and the universal has merged. You have become one with the existence. From that context, everything has to happen, that is what it means. First you establish in yoga, then you act. This is the thing that is going on in India, Yogastha Kur Karmani, always people are talking about it. Without knowing, they think if you twist and turn, you're in yoga. No, that is just a physiological to prepare the body so that it's in some sense of comfort and well-being. But the important thing is, you have a sense of union. As we already went through, your barriers are only of memory. What is yours, what is not yours, what is you, what is not you, all this is rooted in the accumulated memory that you have. So to transcend this is yoga. To transcend the limitations of what you think is me right now is yoga. Now, we are trying to transcend this intellectually, but this whole yogic process essentially means you are absolute maker of your destiny. This is the only culture on the planet which gave you this idea that your life is your karma. That means your life is your doing. The karma, the word karma means act or action. So your life is entirely your making. So this is not… this is a godless culture, I want you to understand. People, Indians will have a little bit of a shock, but they need to go through this because they need to understand you have evolved in a culture which does not believe that you are an absolute stamped by somebody from up there. You are an evolving process. If you're willing to strive, you can go beyond all those so-called natural limitations upon yourself. Now, why is this important? This is important because Adi Yogi might have said it 15,000 years ago and might have given mechanisms and methods to evolve yourself beyond that, but the world was never really ready for it. Human beings were never really ready for it because they did not have the necessary intellect to understand, first of all, what he's talking. In the sense, today, 21st century, more people can think for themselves than ever before. Whether they're thinking right, wrong, that's a questionable thing, but more people are thinking for themselves than ever before. To put it in a very, in a realistic way, see, 100 years ago, women were not even supposed to think. If they thought for themselves, they were branded as witches, and you know what happened to them. So, straight away, with education spreading without gender discriminations, 50% of the human population has come into the thinking process of their own thinking. Once you start thinking, you naturally think logically. Once you think logically, anything that's illogical doesn't fit into your mind. Right now, we are in a cusp of a generation, we are struggling between these two, belief and seeking. Your intellect wants to know, it is seeking, but your memory is soaked in belief. So this is a generation which is right now struggling with this. So as quickly as… because it is essential that we evolve consciously, in this generation, we must raise questions about the fundamentals of everything that we have believed till now. Right now, when I say everything that we have believed, this is something I'm seeing, which was which is a kind of a retrograde in my experience. I was just watching, like you're in Los Angeles, probably if I say football, you will think of that thing which doesn't look like a ball, which they throw.
Yeah.
Because
Yeah.
our idea of a ball is round, so we call it football or soccer now. I was just looking at the history of this game. I saw when people like Pele was playing, George Best was playing, Cruyff was playing, whenever they struck a goal, they just jumped around, they shook hands with each other, or just leapt up or did a somersault, that was it. But now I'm seeing in recent times, whenever they score a goal, they will do, God, you scored the goal. I thought
Yeah.
only Maradona had that hand of God, but it looks like everybody has, because everybody is looking up and praising God. Even in India, when they score a century, they're saying, you scored the century.
Yeah.
Now this is a backward step, I'm saying, because this is important. In this generation, we ask questions. Questions means like this, now you're pointing up. Is it true the planet is round? At least now you know. In India, we have always known the planet was round. You must understand, geography is referred to as Bhugol. That means the studying of the globe. This is not now. I'm talking about Mahabharata times, when 5,000–6,000 years ago they talked about planet being round, not because of Galileo, well before that. So if you look up on a round planet which is spinning, inevitably you're looking up in the wrong direction, I'm saying. So, when you're talking about intellect, this is what intellect should do. It take out everything that's illogical within you. If everything illogical is taken out within you, that means all belief systems are taken out within you, you will naturally come to a state that you clearly understand what you know is so small and what you do not know is limitless. This is what makes you a seeker. You don't become a seeker because I say you become a seeker. You become a seeker because you clearly understand the limitations of your faculties, how far it can go. And when you see there is a wall that you cannot cross, then you understand you need to seek. And instruments of seeking are needed now. Now, till you see, let's say you're in a prison, and the prison was very big, and you thought you were free and you're walking all around. One day you hit the prison wall. Only when you hit the prison wall, just your two legs are no more enough, isn't it? You need something else to burrow through this wall or climb across this wall or fly across this wall. You need a different methodology or a different faculty or a different process for this. This is what spiritual process means. Spiritual process is not looking up or looking down. The word spirituality has become one of the most corrupted words on the planet, but essentially spiritual means you hit the limitations of your physical and psychological structures. So now you're looking for something beyond. Now, something beyond does not mean you score a goal and say this. You're saying that because you think somebody up there is doing it, that means you're a goal scorer by chance. So if you live by chance, anxiety is normal. If you live accidentally, anxiety is normal, isn't it? So right now, that is what everybody is saying. Anxiety is normal, you have to treat yourself, you have to do this. No, anxiety is not normal. Anxiety has come to you because you have assumed things that you do not know. You have used confidence as a bridge, not your clarity. If there was clarity, there would be no anxiety, because confidence is an empty shell. You're always anxious.
But logic, I think that is the confusion. I think that's what we get mixed up. What we think is logical makes sense to us. Like if you say the earth is round, the only way it makes sense to me is if I see a photograph of it. This is my logic. This is what logic does to us.
No,
So,
it's not your logic which got you there, let me tell you. See, if you and me were just walking on this planet, we would be still arguing whether it's flat or round. But this issue was settled when man began to fly. When he went up and looked down, clearly it was like that. Then we went up and stood on the moon and looked down, absolutely clear, it is round. So you distance yourself from your reality. That is when you know this is what is needed for you to understand the limits of your physiological and psychological process. You need a little distance. This is what the tools, the many tools that yoga is providing is just this, to create this distance between you and what you have accumulated. When I say what you have accumulated, I'm not talking about your fancy 12 sets of golf kit, 12 sets of golf clubs that you have, and clothes and I know, it's okay. And many things that you possess. But the very body that you carry is an accumulation. The very mind that you carry is an accumulation. The very genetics that you carry is an accumulation. The very human form is an accumulation of things over a period of time. And the most important dimension of Bharat is this: to possess everything, but never to be possessed by anything.
yes, beautiful. Sadhguru, on that note, we don't have much time left. I will invite a wonderful moderator back. I think she has some questions that were sent in, I believe. So she may be coming on to ask some of those questions. Thank you for being
So,
nice to me today, not yelling at me
Eddie,
the
I will
whole
be…
time.
No, I will be very careful with Eddie because she's not used to my meanness, so
Well, I have to be very careful with my words. I can see that from your conversation so far. So I have some questions that have come through from the audience. Here is one that's come through from Rohan from India. He's asking, what are some simple steps that humans should take in their daily lives towards a more conscious planet or towards becoming a seeker?
uh, well, is this question coming from United States? Because…
From India.
Oh, India is the new West, let me tell you this. The urban India is the urban India is further west from Los Angeles. So, this takeaway culture, okay, you said all this, but what is the takeaway? Tell me three things that I can do. No, there's only one thing that you have to do. No, three things, I'll make it much simpler for you. Only one thing that you have to do is, don't approach your life incrementally. Take 3 days off and everything that you want in your life. Today, if you don't have… if you're in the university, you want to pass this examination, passed. Then what? You need a job, got it. Then what? You need promotion, you got it. Then what? You want $1 million, you got it. Then what? Then you want this car, that house, this wife, that kind, this, everything, everything. Got it, got it, got it, got it right now. Then what? Just look at this one thing, you will become a seeker.
Very
Interesting.
The only problem is, you're approaching… you have a intellect that no other animal has, no other creature on this planet has. You're not making use of it to… the idea of such an intellect and such a vivid sense of memory right now that human beings have, no other creature has the complexity of memory that we have. So the fundamental nature of this is that you don't have to go through every experience of life. Sitting here with your memory structure and your intellect, you can experience everything that human beings experience just by sitting here. Even with eyes closed, you can experience all those things, because all human experience happens within you. The range of possible experiences that can happen within you, you can go through by yourself. You don't have to spend a lifetime to experience little bit of food, little bit of sexuality, little bit of meditation, little bit of this, that, peacefulness, joyfulness, blissfulness, whatever. You can sit here and do all that in the next 5 minutes and be done with life. Does it mean you're done? No. That means the longing to expand beyond these limited things will naturally arise. That's when you become a seeker.
So here's a question from London. This is coming from Shrey in London, and asking what worries you most about the state of the planet today?
I'm not the worrying kind, but well, one thing that we must see, the only choice that we have is this: the planet is not in any kind of peril. It's only human experience which could go through terrible things if we don't take care of a few things. So if you're using the word worry in such a way, yes, what worries most is just the top 39 inches of soil on this planet. The average topsoil on the planet is 39 inches. These 39 inches of soil literally is responsible for over 90% of life on this planet, including us. These 39 inches of soil, there has been a huge amount of degradation in the quality of that soil in terms of its organic content, in terms of the amount of life that should be happening within that. The biodiversity has been dropping drastically in the last 50 to 70 years. So if we don't take care of this 39 inches of the soil, and the only way we can take care of it is to put back substantial organic content into it. The only way we can put back the organic content is the green litter from the trees and the animal waste. Animals we are eating up in billions per year, and trees are largely gone. So this is the concern. If we don't put substantial amount of world's soil under tree shade, if we don't do this in the next 15 to 20 years, I think life on this planet is not going to be pleasant for human beings. Others will reduce in their numbers and they may bounce back the moment human beings are gone. See, this is something we need to understand. We kind of touched upon this when I was talking to Kunal. For example, if all the insects on this planet disappear, all life on this planet will end within 4 to 6 years' time. If all the worms disappear, in 18 to 24 months, all the life will disappear on this planet, including you and me. If all the microbes and, viruses and bacteria and everything disappear, life will end right now. But if all human beings disappear, planet will flourish. So we need to understand this, that we are not the center of the universe. This is one of the most disastrous ideas that has entered human mind, is that in terms of religions and philosophies, people started propagating that every other life here is here to serve human beings. Human being is a centerpiece. Human being is made in God's own image and He is the center and all life is supposed to serve Him. You do one thing, you go to a colony of ants and ask them, do you want to serve human beings? They will come up your legs and they teach you a lesson, all right? They will tell you that they have a complete life of their own. Every creature has a complete life of its own. They are not here to serve us, but their very nature of existence is serving our existence. We must be grateful and respectful and caring about them because we have a capability to create and destroy. Right now, we are largely exercising our capability to destroy, not exercising our ability to create.
Thank you.
So I think time is up. I might ask you one question of my own to finish, which is that there's a lot of discussion about this word resilience. And I wonder what you make of it. You referred to going out into the jungle and living through a monsoon. And I've spoken to other people who've had very tough times growing up, who have come through this current crisis actually in a perhaps a healthier mental state than some of us who didn't have those tougher times. So I wonder if there's any lesson there or anything that you would add to that.
When I was in the
No,
jungle, oh, so you're asking Sadhguru? Sorry, Sadhguru.
I'm sorry, please. Yeah, you want to say something,
I
say
was
it.
joking. I've never been in the jungle. That was a joke.
No, you meant the Jungle Book, I understand.
Yeah, exactly. That's literally what it is. Yeah, literally Mowgli. Yeah, go ahead.
Well, me going through the monsoons in tropical forests were not tough times, they were the best times of my life. I never saw it as tough time, nor do I look back on it as tough time. I described it the way I described because most people don't have an experience of the planet. Their whole experience is always of 65 degrees Fahrenheit. Their air conditioners are set like that, and that's all they know on the four walls in which they're living. By doing this, both physiologically and psychologically, you're becoming fragile. So, one who is living on this planet, experiencing this planet, is not naturally far more resilient, but I don't like to use that word resilient. He's a lot more natural, he's more life. This is why I said, unfortunately, most human beings are given to misunderstand their social and psychological setup as existential realities. Rain, sun, flood, river, ocean, this is all the world. Your ideas of what is this, what is that is all psychological. Every day it can change. You can go through 10 scapes of your psychological phases right now if you're willing, but most people are stuck to one scape. But if you're willing, 10 different… What happened when you were 12 years of age? What was your idea of the world and what was most important to you? What happened when you were 18? What happened when you're 30, 40, 50, 60? If you look at it, you took 60 years to get through this, but if you are willing, you have enough intelligence. I'm saying every human being, not any special human being. Every human being has the necessary intellectual infrastructure to go through all of it within 5 minutes, if he's willing. If he or she is willing, within 5 minutes you can go through the 60 years of experience and evolve quickly. This is what evolving consciously meant. So what you need is not resilience. The word resilience gives you a feeling that you're holding on to something really hard. I'm not holding on to anything really hard. It is just that you have understood and you have experienced that your existence is not independent. It is in relation to everything else. See, the way we launched some of the major massive movements that we launched in India is simply like this. We launched what is called as Rally for Rivers, one Project Green Hands, now Conscious Planet. The basis how I brought this about in people's experience is this. I saw there was not enough green cover in the southern states where we were. So it was 16%, I said our aspiration is 33%, how to get it there? So initially I tried to talk about, see, we need to plant trees, nobody had any attention. Then I made them sit in hot sun at 11 o'clock in the morning. In southern India, it'll get you. So then I moved them under the tree shade and everybody, like that. Then I told them I set up a certain process which is still going on. I said, just breathe and see. What you exhale, the tree is inhaling. What the tree is exhaling, you are inhaling. There is a certain way to make it a living experience within you. Once they sat there and experienced this, they realized one half of their lung is hanging out there. And they're planting trees and planting trees, you can't stop them now. Because they know it's their lungs.
It's a really beautiful place to stop. I wish we could continue, but Sadhguru and Kunal Nair, it's been such a pleasure having you on the Be the Revival, the India Global Week. I've been Edie Lush, and I hope very much to come into contact with you guys again.
Thank you.
Namaskaram,
Thank you
and my best wishes for the India week that's happening. Manoj and others who are putting this together. The most important aspect of India is this: an absolute experience of inclusiveness and an immense experience of life is what we call as Bharat or yoga. So this experience needs to happen to every human being if you want to make human beings as supportive and productive as microorganisms are to life. Good time to look at it at the time of virus, you know.
Thank you.
Thank you very much. Namaskar.